Psychotherapy, also psychological therapy, talk therapy, or talking therapy, is the use of psychological methods, particularly when based on regular personal interaction, to help a person change behavior, increase happiness, and overcome problems. Psychotherapy aims to improve an individual's well-being and mental health, to resolve or mitigate troublesome behaviors, beliefs, compulsions, thoughts, or emotions, and to improve relationships and social skills. 1. Numerous types of psychotherapy have been designed either for individual adults, families, or children and adolescents. Certain types of psychotherapy are considered evidence-based for treating some diagnosed mental disorders. Other types have been criticized as pseudoscience. 2. There are hundreds of psychotherapy techniques, some being minor variations, others are based on very different conceptions of psychology. 3. Most involve one-to-one sessions, between the client and therapist, but some are conducted with groups. 4. Including families. Psychotherapists may be mental health professionals such as psychiatrists, psychologists, mental health nurses, clinical social workers, marriage and family therapists, or professional counselors. Psychotherapists may also come from a variety of other backgrounds, and depending on the jurisdiction may be legally regulated, voluntarily regulated or unregulated, and the term itself may be protected or not. Definitions. The term psychotherapy is derived from ancient Greek psyche, psyupsilon chi meaning breath, spirit, soul, and therapia, theta epsilon rho alpha pi epsilon alpha healing, medical treatment. The Oxford English Dictionary defines it as the treatment of disorders of the mind or personality by psychological means. However, in earlier use it denoted the treatment of disease through hypnotic suggestion. 5. Psychotherapy is often dubbed as a talking therapy or talk therapy, particularly for a general audience. 6. Though not all forms of psychotherapy rely on verbal communication. 7. Children or adults who do not engage in verbal communication, or not in the usual way, are not excluded from psychotherapy. Indeed, some types are designed for such cases. The American Psychological Association adopted a resolution on the effectiveness of psychotherapy in 2012 based on a definition developed by American psychologist John C. Norcross. Psychotherapy is the informed and intentional application of clinical methods and interpersonal stances derived from established psychological principles for the purpose of assisting people to modify their behaviors, cognitions, emotions, and/or other personal characteristics in directions that the participants deem desirable. 8. 9. Influential editions of a work by psychiatrist Jerome Frank defined psychotherapy as a healing relationship using socially authorized methods in a series of contacts primarily involving words, acts and rituals, which Frank regarded as forms of persuasion and rhetoric. 10. Historically, psychotherapy has sometimes meant interpretative, i.e. Freudian, methods, namely psychoanalysis, in contrast with other methods to treat psychiatric disorders such as behavior modification. 11. Some definitions of counseling overlap with psychotherapy, particularly in non-directive client-centered approaches, or counseling may refer to guidance for everyday problems in specific areas, typically for shorter durations with a less medical or professional focus. 12. Somatotherapy refers to the use of physical changes as injuries and illnesses, and sociotherapy to the use of a person's social environment to effect therapeutic change. 13. Psychotherapy may address spirituality as a significant part of someone's mental/psychological life, and some forms are derived from spiritual philosophies, but practices based on treating the spiritual as a separate dimension are not necessarily considered as traditional or legitimate forms of psychotherapy. Delivery. Psychotherapy may be delivered in person, one-on-one, or with couples, or in groups, or via telephone counseling or online counseling. See also telepsychotherapy. 15. There have also been developments in computer-assisted therapy, such as virtual reality therapy for behavioral exposure, multimedia programs to teach cognitive techniques, and handheld devices for improved monitoring or putting ideas into practice. See also computer-supported. 15. 16. Most forms of psychotherapy use spoken conversation. Some also use various other forms of communication such as the written word, artwork, drama, narrative story, or music. Psychotherapy with children and their parents often involves play, dramatization, i.e. role play, and drawing, with a co-constructed narrative from these nonverbal and displaced modes of interacting. 17. Regulation. See also, psychologist licensing and regulations, counseling psychology counseling ethics and regulation, psychiatrist professional requirements, health professional requisites, social work qualifications, and mental health professional distinctions. Psychotherapists traditionally may be mental health professionals like psychologists and psychiatrists, professionals from other backgrounds, family therapists, social workers, nurses, etc., who have trained in a specific psychotherapy, or, in some cases, academic or scientifically trained professionals. Psychiatrists are trained first as physicians, and as such they may prescribe prescription medication, and specialist psychiatric training begins after medical school in psychiatric residencies. However, their specialty is in mental disorders or forms of mental illness. 18. Clinical psychologists have specialist doctoral degrees in psychology with some clinical and research components. Other clinical practitioners, social workers, mental health counselors, pastoral counselors, and nurses with a specialization in mental health, also often conduct psychotherapy. Many of the wide variety of psychotherapy training programs and institutional settings are multi-professional. In most countries, psychotherapy training is completed at a postgraduate level, often at a master's degree, or doctoral level, over 4 years, with significant supervised practice and clinical placements. Mental health professionals that choose to specialize in psychotherapeutic work also require a program of continuing professional education after basic professional training. 19. A listing of the extensive professional competencies of a European psychotherapist was developed by the European Association of Psychotherapy, EAP, in 2013. 20. As sensitive and deeply personal topics are often discussed during psychotherapy, therapists are expected, and usually legally bound, to respect client or patient confidentiality. The critical importance of client confidentiality and the limited circumstances in which it may need to be broken for the protection of clients or others is enshrined in the Regulatory Psychotherapeutic Organization's Codes of Ethical Practice. 21. Examples of when it is typically accepted to break confidentiality include when the therapist has knowledge that a child or elder is being physically abused, when there is a direct, clear and imminent threat of serious physical harm to self or to a specific individual. Europe. As of 2015, there are still a lot of variations between different European countries about the regulation and delivery of psychotherapy. Several countries have no regulation of the practice or no protection of the title. Some have a system of voluntary registration with independent professional organizations, while other countries attempt to restrict the practice of psychotherapy to mental health professionals, psychologists and psychiatrists, with state-certified training. The titles that are protected also vary. 22. The European Association for Psychotherapy, EAP, established the 1990 Strasbourg Declaration on Psychotherapy, which is dedicated to establishing an independent profession of psychotherapy in Europe, with pan-European standards. 23. The EAP has already made significant contacts with the European Union and European Commission towards this end. Given that the European Union has a primary policy about the free movement of labor within Europe, European legislation can overrule national regulations that are, in essence, forms of restrictive practices. In Germany, the practice of psychotherapy for adults is restricted to qualified psychologists and physicians, including psychiatrists, who have completed several years of specialist practical training and certification in psychotherapy. As psychoanalysis, psychodynamic therapy, and cognitive behavioral therapy meet the requirements of German health insurance companies, mental health professionals regularly opt for one of these three specializations in their postgraduate training. For psychologists, this includes 3 years of full-time practical training, 4,200 hours, encompassing a year-long internship at an accredited psychiatric institution, 6 months of clinical work at an outpatient facility, 600 hours of supervised psychotherapy in an outpatient setting, and at least 600 hours of theoretical seminars. 24. Social workers may complete the specialist training for child and teenage clients. 25. Similarly in Italy, the practice of psychotherapy is restricted to graduates in psychology or medicine who have completed 4 years of recognized specialist training. 26. 27. Sweden has a similar restriction on the title psychotherapist, which may only be used by professionals who have gone through a postgraduate training in psychotherapy and then applied for a license, issued by the National Board of Health and Welfare. 28. Legislation in France restricts the use of the title psychotherapist to professionals on the National Register of Psychotherapists. 29. which requires a training in clinical psychopathology and a period of internship which is only open to physicians or titulars of a master's degree in psychology or psychoanalysis. Citation needed. Austria and Switzerland, 2011, have laws that recognize multidisciplinary functional approaches. Citation needed. In the United Kingdom, the Government and Health and Care Professions Council considered mandatory legal registration but decided that it was best left to professional bodies to regulate themselves, so the Professional Standards Authority for Health and Social Care, PSA, launched an accredited voluntary registers scheme. 30, 31, 32, 33, 34. Counseling and psychotherapy are not protected titles in the United Kingdom. Counselors and psychotherapists who have trained and qualify to a certain standard, usually a Level 4 diploma, can apply to be members of the professional bodies who are listed on the PSA accredited registers. United States. In some states, counselors or therapists must be licensed to use certain words and titles on self-identification or advertising. In some other states, the restrictions on practice are more closely associated with the charging of fees. Licensing and regulation are performed by various states. Presentation of practice as licensed, but without such a license, is generally illegal. 35. Without a license, for example, a practitioner cannot bill insurance companies. 36. Information about state licensure is provided by the American Psychological Association. 37. In addition to state laws, the American Psychological Association requires its members to adhere to its published ethical principles of psychologists and code of conduct. 38. The American Board of Professional Psychology examines and certifies psychologists who demonstrate competence in approved specialty areas in professional psychology. 39. Canada. Regulation of psychotherapy is in the jurisdiction of, and varies among, the provinces and territories. In Quebec, psychotherapy is a regulated activity which is restricted to psychologists, medical doctors, and holders of a psychotherapy permit issued by the Ordre des Psychologues du Québec, the Quebec Order of Psychologists. Members of certain specified professions, including social workers, couple and family therapists, occupational therapists, guidance counselors, criminologists, sexologists, psychoeducators, and registered nurses may obtain a psychotherapy permit by completing certain educational and practice requirements. Their professional oversight is provided by their own professional orders. Some other professionals who were practicing psychotherapy before the current system came into force continue to hold psychotherapy permits alone. 40. On July 1, 2019, Ontario's Missing Persons Act came into effect, with the purpose of giving police more power to investigate missing persons. It allows police to require, as opposed to permit, health professionals, including psychotherapists, to share otherwise confidential documents about their client, if there is reason to believe their client is missing. 41, 42. Some have expressed concern that this legislation undermines psychotherapy confidentiality and could be abused maliciously by police. 43. While others have praised the act for how it respects privacy and includes checks and balances. 44. History. See also, History of Psychotherapy and Timeline of Psychotherapy. Psychotherapy can be said to have been practiced through the ages, as medics, philosophers, spiritual practitioners and people in general used psychological methods to heal others. 45, 46. In the Western tradition, by the 19th century, a moral treatment movement, then meaning morale or mental, developed based on non-invasive non-restraint therapeutic methods. 47. Another influential movement was started by Franz Mesmer, 1734 to 1815, and his student Armand-Marie Jacques de Chassenet, Marquis of Pisgah, 1751 to 1825. Called mesmerism or animal magnetism, it would have a strong influence on the rise of dynamic psychology and psychiatry as well as theories about hypnosis. 48, 49. In 1853, Walter Cooper Dendy introduced the term psychotherapia regarding how physicians might influence the mental states of patients and thus their bodily ailments, for example by creating opposing emotions to promote mental balance. 50, 51. Daniel Hack-Tuke cited the term and wrote about psychotherapeutics in 1872, in which he also proposed making a science of animal magnetism. 52, 53. Hippolyte Bernheim and colleagues in the Nancy School developed the concept of psychotherapy in the sense of using the mind to heal the body through hypnotism. Yet further. 52. Charles Lloyd Tukey's 1889 work, psychotherapeutics, or treatment by hypnotism and suggestion popularized the work of the Nancy School in English, 52, 54. Also in 1889 a clinic used the word in its title for the first time, when Frederik van Eeden and Albert Willem van Rentergem in Amsterdam renamed theirs. Clinique de Psychothérapeutique Suggestive. After visiting Nancy, 52, during this time, traveling stage hypnosis became popular, and such activities added to the scientific controversies around the use of hypnosis in medicine, 52. Also in 1892, at the Second Congress of Experimental Psychology, Van Eeden attempted to take the credit for the term psychotherapy and to distance the term from hypnosis, 52. In 1896, the German journal Zeitschrift für Hypnotismus, Suggestionstherapie, Suggestionslehre und Verwandte psychologische Forschungen changed its name to Zeitschrift für Hypnotismus, Psychotherapie sowie andere psychophysiologische und psychopathologische Forschungen, which is probably the first journal to use the term, 52. Thus psychotherapy initially meant the treatment of disease by psychic or hypnotic influence, or by suggestion. 5. Freud, seated left of picture with Jung seated at the right of the picture. 1909. Sigmund Freud visited the Nancy School and his early neurological practice involved the use of hypnotism. However, following the work of his mentor Joseph Breuer, in particular a case where symptoms appeared partially resolved by what the patient, Bertha Pappenheim, dubbed a talking cure, Freud began focusing on conditions that appeared to have psychological causes originating in childhood experiences and the unconscious mind. He went on to develop techniques such as free association, dream interpretation, transference and analysis of the ID, ego and superego. His popular reputation as the father of psychotherapy was established by his use of the distinct term psychoanalysis, tied to an overarching system of theories and methods, and by the effective work of his followers in rewriting history. 52. Many theorists, including Alfred Adler, Carl Jung, Karen Horney, Anna Freud, Otto Rank, Erik Erikson, Melanie Klein and Heinz Kohut, built upon Freud's fundamental ideas and often developed their own systems of psychotherapy. These were all later categorized as psychodynamic, meaning anything that involved the psyche's conscious/unconscious influence on external relationships and the self. Sessions tended to number into the hundreds over several years. Behaviorism developed in the 1920s, and behavior modification as a therapy became popularized in the 1950s and 1960s. Notable contributors were Joseph Wolpe in South Africa, M.B. Shapiro and Hans Eysenck, 55, in Britain, and John B. Watson and B.F. Skinner in the United States. Behavioral therapy approaches relied on principles of operant conditioning, classical conditioning and social learning theory to bring about therapeutic change in observable symptoms. The approach became commonly used for phobias, as well as other disorders. 56. Some therapeutic approaches developed out of the European school of existential philosophy, concerned mainly with the individual's ability to develop and preserve a sense of meaning and purpose throughout life. Major contributors to the field, example, Irvin Yalom, Rollo May, and Europe, Viktor Frankl, Ludwig Binswanger, Medard Boss, R.D. Lang, Emmy van Deurzen, attempted to create therapies sensitive to common life crises springing from the essential bleakness of human self-awareness, previously accessible only through the complex writings of existential philosophers, example, Soren Kierkegaard, Jean-Paul Sartre, Gabriel Marcel, Martin Heidegger, Friedrich Nietzsche. The uniqueness of the patient-therapist relationship thus also forms a vehicle for therapeutic inquiry. A related body of thought in psychotherapy started in the 1950s with Carl Rogers. Based also on the works of Abraham Maslow and his hierarchy of human needs, Rogers brought person-centered psychotherapy into mainstream focus. The primary requirement was that the client receive 3 core conditions from his counselor or therapist: unconditional positive regard, sometimes described as prizing the client's humanity, congruence, authenticity/genuineness/transparency, and empathic understanding. This type of interaction was thought to enable clients to fully experience and express themselves, and thus develop according to their innate potential. 57. Others developed the approach, like Fritz and Laura Perls in the creation of Gestalt therapy, as well as Marshall Rosenberg, founder of nonviolent communication, and Eric Berne, founder of transactional analysis. Later these fields of psychotherapy would become what is known as humanistic psychotherapy today. Self-help groups and books became widespread. During the 1950s, Albert Ellis originated rational emotive behavior therapy, REBT. Independently a few years later, psychiatrist Aaron T. Beck developed a form of psychotherapy known as cognitive therapy. Both of these included relatively short, structured and present-focused techniques aimed at identifying and changing a person's beliefs, appraisals and reaction patterns, by contrast with the more long-lasting insight-based approach of psychodynamic or humanistic therapies. Beck's approach used primarily the Socratic method, and links have been drawn between ancient Stoic philosophy and these cognitive therapies. 58. Cognitive and behavioral therapy approaches were increasingly combined and grouped under the umbrella term cognitive behavioral therapy, CBT, in the 1970s. Many approaches within CBT are oriented towards active/directive yet collaborative empiricism, a form of reality testing, and assessing and modifying core beliefs and dysfunctional schemas. These approaches gained widespread acceptance as a primary treatment for numerous disorders. A third wave of cognitive and behavioral therapies developed, including acceptance and commitment therapy and dialectical behavior therapy, which expanded the concepts to other disorders and/or added novel components and mindfulness exercises. However, the third wave concept has been criticized as not essentially different from other therapies and having roots in earlier ones as well. 59. Counseling methods developed include solution-focused therapy and systemic coaching. Therapy may address specific forms of diagnosable mental illness, or everyday problems in managing or maintaining interpersonal relationships or meeting personal goals. A course of therapy may happen before, during or after pharmacotherapy, e.g., taking psychiatric medication. Psychotherapies are categorized in several different ways. A distinction can be made between those based on a medical model and those based on a humanistic model. In the medical model, the client is seen as unwell and the therapist employs their skill to help the client back to health. The extensive use of the DSM-IV, the Diagnostic and Statistical Manual of Mental Disorders in the United States, is an example of a medically exclusive model. The humanistic or non-medical model in contrast strives to depathologize the human condition. The therapist attempts to create a relational environment conducive to experiential learning and help build the client's confidence in their own natural process, resulting in a deeper understanding of themselves. The therapist may see themselves as a facilitator/helper. Another distinction is between individual one-to-one therapy sessions and group psychotherapy, including couples therapy and family therapy. 67. Therapies are sometimes classified according to their duration. A small number of sessions over a few weeks or months may be classified as brief therapy or short-term therapy. Others, where regular sessions take place for years, may be classified as long-term. Some practitioners distinguish between more uncovering or depth approaches and more supportive psychotherapy. Uncovering psychotherapy emphasizes facilitating the client's insight into the roots of their difficulties. The best-known example is classical psychoanalysis. Supportive psychotherapy, by contrast, stresses strengthening the client's coping mechanisms and often providing encouragement and advice, as well as reality testing and limit setting where necessary. Depending on the client's issues and situation, a more supportive or more uncovering approach may be optimal. 68. Humanistic. Main article, Humanistic Psychology. These psychotherapies, also known as experiential, are based on humanistic psychology and emerged in reaction to both behaviorism and psychoanalysis, being dubbed the third force. They are primarily concerned with the human development and needs of the individual, with an emphasis on subjective meaning, a rejection of determinism, and a concern for positive growth rather than pathology. 69. Some posit an inherent human capacity to maximize potential, the self-actualizing tendency. The task of therapy is to create a relational environment where this tendency might flourish. 70. Humanistic psychology can, in turn, be rooted in existentialism, the belief that human beings can only find meaning by creating it. This is the goal of existential therapy. Existential therapy is in turn philosophically associated with phenomenology. 71. 72. Person-centered therapy, also known as client-centered, focuses on the therapist showing openness, empathy and unconditional positive regard, to help clients express and develop their own self. 73. Humanistic psychodrama, HPD, is based on the human image of humanistic psychology. 74. So all rules and methods follow the axioms of humanistic psychology. The HPD sees itself as development-oriented psychotherapy and has completely moved away from the psychoanalytic catharsis theory. 75. Self-awareness and self-realization are essential aspects in the therapeutic process. Subjective experiences, feelings and thoughts in one's own experiences are the starting point for a change or reorientation in experience and behavior in the direction of more self-acceptance and satisfaction. Dealing with the biography of the individual is closely related to the sociometry of the group. 76. Gestalt therapy, originally called concentration therapy, is an existential/experiential form that facilitates awareness in the various contexts of life, by moving from talking about relatively remote situations to action and direct current experience. Derived from various influences, including an overhaul of psychoanalysis, it stands on top of essentially four load-bearing theoretical walls: phenomenological method, dialogical relationship, field theoretical strategies, and experimental freedom. 77. A briefer form of humanistic therapy is the Human-Givens approach, introduced in 1998, 99, 78. It is a solution-focused intervention based on identifying emotional needs such as for security, autonomy and social connection, and using various educational and psychological methods to help people meet those needs more fully or appropriately. 79, 80, 81, 82. Insight-oriented. Main article, Insight-oriented psychotherapy. Insight-oriented psychotherapies focus on revealing or interpreting unconscious processes. Most commonly referring to psychodynamic therapy, of which psychoanalysis is the oldest and most intensive form, these applications of depth psychology encourage the verbalization of all the patient's thoughts, including free associations, fantasies, and dreams, from which the analyst formulates the nature of the past and present unconscious conflicts which are causing the patient's symptoms and character problems. There are 6 main schools of psychoanalysis, which all influenced psychodynamic theory. Frowny face 83, Freudian, ego psychology, object relations theory, self-psychology, interpersonal psychoanalysis, 84, 85, and relational psychoanalysis, 86. Techniques for analytic group therapy have also developed. Cognitive behavioral. Main article, Cognitive behavioral therapy. Behavior therapies use behavioral techniques, including applied behavior analysis, also known as behavior modification, to change maladaptive patterns of behavior to improve emotional responses, cognitions, and interactions with others. Functional analytic psychotherapy is one form of this approach. By nature, behavioral therapies are empirical, data-driven, contextual, focused on the environment and context, functional, interested in the effect or consequence a behavior ultimately has, probabilistic, viewing behavior as statistically predictable, monistic, rejecting mind-body dualism and treating the person as a unit, and relational, analyzing bidirectional interactions. 87. Cognitive therapy focuses directly on changing the thoughts, in order to improve the emotions and behaviors. Cognitive behavioral therapy attempts to combine the above two approaches, focused on the construction and reconstruction of people's cognitions, emotions, and behaviors. Generally in CBT, the therapist, through a wide array of modalities, helps clients assess, recognize, and deal with problematic and dysfunctional ways of thinking, emoting, and behaving. The concept of third-wave psychotherapies reflects an influence of Eastern philosophy and clinical psychology, incorporating principles such as meditation into interventions such as mindfulness-based cognitive therapy, acceptance and commitment therapy, and dialectical behavior therapy for borderline personality disorder. 63. Interpersonal psychotherapy, IPT, is a relatively brief form of psychotherapy, deriving from both CBT and psychodynamic approaches, that has been increasingly studied and endorsed by guidelines for some conditions. It focuses on the links between mood and social circumstances, helping to build social skills and social support. 88. It aims to foster adaptation to current interpersonal roles and situations. Exposure and response prevention, ERP, is primarily deployed by therapists in the treatment of OCD. The American Psychiatric Association, APA, state that CBT, drawing primarily on behavioral techniques, such as ERP, has the strongest evidence base among psychosocial interventions. 89. By confronting feared scenarios, i.e., exposure, and refraining from performing rituals, i.e., responsive prevention, patients may gradually feel less distress in confronting feared stimuli, while also feeling less inclination to use rituals to relieve that distress. Typically, ERP is delivered in hierarchical fashion, meaning patients confront increasingly anxiety-provoking stimuli as they progress through a course of treatment. 90, 91. Other types include reality therapy/choice theory, multimodal therapy, and therapies for specific disorders including PTSD therapies such as cognitive processing therapy and EMDR, substance abuse therapies such as relapse prevention and contingency management, and co-occurring disorders therapies such as seeking safety. 92. Systemic. Main article, Systemic Therapy. Group Therapy, Ukraine. Systemic therapy seeks to address people not just individually, as is often the focus of other forms of therapy, but in relationship, dealing with the interactions of groups, their patterns and dynamics, includes family therapy and marriage counseling. Community psychology is a type of systemic psychology. The term group therapy was first used around 1920 by Jacob L. Moreno, whose main contribution was the development of psychodrama, in which groups were used as both cast and audience for the exploration of individual problems by reenactment under the direction of the leader. The more analytic and exploratory use of groups in both hospital and outpatient settings was pioneered by a few European psychoanalysts who emigrated to the U.S., such as Paul Schilder, who treated severely neurotic and mildly psychotic outpatients in small groups at Bellevue Hospital, New York. The power of groups was most influentially demonstrated in Britain during the Second World War, when several psychoanalysts and psychiatrists proved the value of group methods for officer selection in the War Office selection boards. A chance to run an Army psychiatric unit on group lines was then given to several of these pioneers, notably Wilfred Bion and Rickman, followed by S. H. Falks, Maine, and Bridger. The Northfield Hospital in Birmingham gave its name to what came to be called the two Northfield experiments, which provided the impetus for the development since the war of both social therapy, that is, the therapeutic community movement, and the use of small groups for the treatment of neurotic and personality disorders. Today group therapy is used in clinical settings and in private practice settings. 93. Expressive. Main article, Expressive Therapy. Expressive psychotherapy is a form of therapy that utilizes artistic expression, via improvisational, compositional, recreative, and receptive experiences, as its core means of treating clients. Expressive psychotherapists use the different disciplines of the creative arts as therapeutic interventions. This includes the modalities dance therapy, drama therapy, art therapy, music therapy, writing therapy, among others. 94. This may include techniques such as affect labeling. Expressive psychotherapists believe that often the most effective way of treating a client is through the expression of imagination in creative work and integrating and processing what issues are raised in the act. Postmodernist. Also known as post-structuralist or constructivist. Narrative therapy gives attention to each person's dominant story through therapeutic conversations, which also may involve exploring unhelpful ideas and how they came to prominence. Possible social and cultural influences may be explored if the client deems it helpful. Coherence therapy posits multiple levels of mental constructs that create symptoms as a way to strive for self-protection or self-realization. Feminist therapy does not accept that there is one single or correct way of looking at reality and therefore is considered a postmodernist approach. 95. Transpersonal psychology addresses the client in the context of a spiritual understanding of consciousness. Positive psychotherapy, PPT, since 1968, is a method in the field of humanistic and psychodynamic psychotherapy and is based on a positive image of humans, with a health-promoting, resource-oriented and conflict-centered approach. Hypnotherapy is undertaken while a subject is in a state of hypnosis. Hypnotherapy is often applied in order to modify a subject's behavior, emotional content, and attitudes, as well as a wide range of conditions including dysfunctional habits. 96, 97, 98, 99, 100, anxiety, 101, stress-related illness, 102, 103, 104, pain management, 105, unreliable source, 106, and personal development, 107, unreliable source, 108. Psychedelic therapy are therapeutic practices involving psychedelic drugs, such as LSD, psilocybin, DMT, and MDMA. 109. In psychedelic therapy, in contrast to conventional psychiatric medication taken by the patient regularly or as needed, patients generally remain in an extended psychotherapy session during the acute psychedelic activity with additional sessions both before and after in order to help integrate experiences with the psychedelics. 110, 111. Psychedelic therapy has been compared with the shamanic healing rituals of indigenous people. Researchers identified two main differences: The first is the shamanic belief that multiple realities exist and can be explored through altered states of consciousness, and second the belief that spirits encountered in dreams and visions are real. 112, 111. The Charitable Initiative Founders Pledge has written a research report on cost-effective giving opportunities for funding psychedelic-assisted mental health treatments. 113, 114. Body psychotherapy, part of the field of somatic psychology, focuses on the link between the mind and the body and tries to access deeper levels of the psyche through greater awareness of the physical body and emotions. There are various body-oriented approaches, such as Reichian, Wilhelm Reich, character analytic vegetotherapy and orgonomy, neo-Reichian bioenergetic analysis, somatic experiencing, integrative body psychotherapy, Ron Kurtz's Hakomi psychotherapy, sensorimotor psychotherapy, biosynthesis psychotherapy, and biodynamic psychotherapy. These approaches are not to be confused with body work or body therapies that seek to improve primarily physical health through direct work, touch and manipulation, on the body, rather than through directly psychological methods. Some non-Western indigenous therapies have been developed. In African countries this includes harmony restoration therapy, mesoron therapy and systemic therapies based on the Ubuntu philosophy. 115, 116, 117. Integrative psychotherapy is an attempt to combine ideas and strategies from more than one theoretical approach. 118. These approaches include mixing core beliefs and combining proven techniques. Forms of integrative psychotherapy include multimodal therapy, the trans-theoretical model, cyclical psychodynamics, systematic treatment selection, cognitive analytic therapy, internal family systems model, multi-theoretical psychotherapy and conceptual interaction. In practice, most experienced psychotherapists develop their own integrative approach over time. Child psychotherapy needs to be adapted to meet the developmental needs of children. Depending on age, it is generally held to be one part of an effective strategy to help the needs of a child within the family setting. 119. Child psychotherapy training programs necessarily include courses in human development. Since children often do not have the ability to articulate thoughts and feelings, psychotherapists will use a variety of media such as musical instruments, sand and toys, crayons, paint, clay, puppets, bibliocounseling, books, or board games. The use of play therapy is often rooted in psychodynamic theory, but other approaches also exist. In addition to therapy for the child, sometimes instead of it, children may benefit if their parents work with a therapist, take parenting classes, attend grief counseling, or take other action to resolve stressful situations that affect the child. Parent management training is a highly effective form of psychotherapy that teaches parenting skills to reduce their child's behavior problems. In many cases, a different psychotherapist will work with the caretaker of the child, while a colleague works with the child. 120. Therefore, contemporary thinking on working with the younger age group has leaned towards working with parent and child simultaneously, as well as individually as needed. 121, 122. Computer-supported. See also, online counseling and use of technology in treatment of mental disorders. Research on computer-supported and computer-based interventions has increased significantly over the course of the last 2 decades. 123, 124. The following applications frequently have been investigated. Virtual reality, VR, is a computer-generated scenario that simulates experience. The immersive environment, used for simulated exposure, can be similar to the real world or it can be fantastical, creating a new experience. 125, 126. Computer-based interventions, or online interventions or internet interventions. These interventions can be described as interactive self-help. They usually entail a combination of text, audio or video elements. 127, 128. Computer-supported therapy, or blended therapy. Classical psychotherapy is supported by means of online or software application elements. The feasibility of such interventions has been investigated for individual, 129, and group therapy, 130, 131. Telepsychotherapy. Telepsychiatry or telemental health refers to the use of telecommunications technology, mostly video conferencing and phone calls, to deliver psychiatric care remotely for people with mental health conditions. It is a branch of telemedicine. 132, 133. Telepsychiatry can be effective in treating people with mental health conditions. In the short term it can be as acceptable and effective as face-to-face care. 134. It can improve access to mental health services for some but might also represent a barrier for those lacking access to a suitable device, the internet or the necessary digital skills. Factors such as poverty that are associated with lack of internet access are also associated with greater risk of mental health problems, making digital exclusion an important problem of telemental health services. 134. During the COVID-19 pandemic, mental health services were adapted to telemental health in high-income countries. It proved effective and acceptable for use in an emergency situation, but there were concerns regarding its long-term implementation. 135. Effects. Evaluation. There is considerable controversy about whether, or when, psychotherapy efficacy is best evaluated by randomized controlled trials or more individualized idiographic methods. 136. One issue with trials is what to use as a placebo treatment group or non-treatment control group. Often, this group includes patients on a waiting list, or those receiving some kind of regular nonspecific contact or support. Researchers must consider how best to match the use of inert tablets or sham treatments in placebo-controlled studies in pharmaceutical trials. Several interpretations and differing assumptions and language remain. 137. Another issue is the attempt to standardize and manualize therapies and link them to specific symptoms of diagnostic categories, making them more amenable to research. Some report that this may reduce efficacy or gloss over individual needs. Fonagy and Roth's opinion is that the benefits of the evidence-based approach outweighs the difficulties. 138. There are several formal frameworks for evaluating whether a psychotherapist is a good fit for a patient. One example is the Scarsdale Psychotherapy Self-Evaluation, SPSE. 139. However, some scales, such as the SPS, elicit information specific to certain schools of psychotherapy alone, e.g. the superego. Many psychotherapists believe that the nuances of psychotherapy cannot be captured by questionnaire-style observation, and prefer to rely on their own clinical experiences and conceptual arguments to support the type of treatment they practice. Psychodynamic therapists increasingly believe that evidence-based approaches are appropriate to their methods and assumptions, and have increasingly accepted the challenge to implement evidence-based approaches in their methods. 140. A pioneer in investigating the results of different psychological therapies was psychologist Hans Eysenck, who argued that psychotherapy does not produce any improvement in patients. He held that behavior therapy is the only effective one. However, it was revealed that Eysenck, who died in 1997, falsified data in his studies about this subject, fabricating data that would indicate that behavioral therapy enables achievements that are impossible to believe. 14 of his papers were retracted by journals in 2020, and journals issued 64 statements of concern about publications by him. Rod Buchanan, a biographer of Eysenck, has argued that 87 publications by Eysenck should be retracted. 141, 142, 143, 144, 145, 146, 147. Outcomes in relation with selected kinds of treatment. Large-scale international reviews of scientific studies have concluded that psychotherapy is effective for numerous conditions. 8.22. One line of research consistently finds that supposedly different forms of psychotherapy show similar effectiveness. According to the Handbook of Counseling Psychology, meta-analyses of psychotherapy studies have consistently demonstrated that there are no substantial differences in outcomes among treatments. The handbook states that there is little evidence to suggest that any one psychological therapy consistently outperforms any other for any specific psychological disorders. This is sometimes called the dodo bird verdict after a scene/section in Alice in Wonderland where every competitor in a race was called a winner and is given prizes. 148. Further analyses seek to identify the factors that the psychotherapies have in common that seem to account for this, known as common factors theory. For example, the quality of the therapeutic relationship, interpretation of problem, and the confrontation of painful emotions. 149, 150, page needed. 151, 152. Outcome studies have been critiqued for being too removed from real-world practice in that they use carefully selected therapists who have been extensively trained and monitored, and patients who may be non-representative of typical patients by virtue of strict inclusionary/exclusionary criteria. Such concerns impact the replication of research results and the ability to generalize from them to practicing therapists. 150, 153. However, specific therapies have been tested for use with specific disorders. 154, and regulatory organizations in both the UK and US make recommendations for different conditions. 155, 156, 157. The Helsinki Psychotherapy Study was one of several large long-term clinical trials of psychotherapies that have taken place. Anxious and depressed patients in 2 short-term therapies, solution-focused and brief psychodynamic, improved faster, but 5 years long-term psychotherapy and psychoanalysis gave greater benefits. Several patient and therapist factors appear to predict suitability for different psychotherapies. 158. Meta-analyses have established that cognitive behavioral therapy, CBT, and psychodynamic psychotherapy are equally effective in treating depression. 159. A 2014 meta-analysis over 11,000 patients reveals that interpersonal psychotherapy, IPT, is of comparable effectiveness to CBT for depression but is inferior to the latter for eating disorders. 160. For children and adolescents, interpersonal psychotherapy and CBT are the best methods according to a 2014 meta-analysis of almost 4,000 patients. 161. Mechanisms of change. It is not yet understood how psychotherapies can succeed in treating mental illnesses. 162. Different therapeutic approaches may be associated with particular theories about what needs to change in a person for a successful therapeutic outcome. In general, processes of emotional arousal and memory have long been held to play an important role. One theory combining these aspects proposes that permanent change occurs to the extent that the neuropsychological mechanism of memory reconsolidation is triggered and is able to incorporate new emotional experiences. 163, 164, 165, 166. Adherence. Patient adherence to a course of psychotherapy, continuing to attend sessions or complete tasks is a major issue. The dropout level, early termination, ranges from around 30% to 60%, depending partly on how it is defined. The range is lower for research settings for various reasons, such as the selection of clients and how they are inducted. Early termination is associated on average with various demographic and clinical characteristics of clients, therapists, and treatment interactions. 167, 168. The high level of dropout has raised some criticism about the relevance and efficacy of psychotherapy. 169. Most psychologists use between-session tasks in their general therapy work, and cognitive behavioral therapies in particular use and see them as an active ingredient. It is not clear how often clients do not complete them, but it is thought to be a pervasive phenomenon. 167. From the other side, the adherence of therapists to therapy protocols and techniques known as treatment integrity or fidelity has also been studied, with complex mixed results. 170. In general, however, it is a hallmark of evidence-based psychotherapy to use fidelity monitoring as part of therapy outcome trials and ongoing quality assurance in clinical implementation. Adverse effects. Research on adverse effects of psychotherapy has been limited, yet worsening of symptoms may be expected to occur in 3% to 15% of patients, with variability across patient and therapist characteristics. 171, 172, 173. Potential problems include deterioration of symptoms or developing new symptoms, strains in other relationships, social stigma, and therapy dependence. 174. Some techniques or therapists may carry more risks than others, and some client characteristics may make them more vulnerable. 172. Side effects from properly conducted therapy should be distinguished from harms caused by malpractice. 174. General critiques. Some critics are skeptical of the healing power of psychotherapeutic relationships. 175, 176. 177. Some dismiss psychotherapy altogether in the sense of a scientific discipline requiring professional practitioners. 178. Instead favoring either non-professional help. 178. Or biomedical treatments. 179. Others have pointed out ways in which the values and techniques of therapists can be harmful as well as helpful to clients, or indirectly to other people in a client's life. 180, 181. 182. Many resources available to a person experiencing emotional distress: the friendly support of friends, peers, family members, clergy contacts, personal reading, healthy exercise, research, and independent coping all present considerable value. Critics note that humans have been dealing with crises, navigating severe social problems and finding solutions to life problems long before the advent of psychotherapy. 183. On the other hand, some argue psychotherapy is underutilized and under-researched by contemporary psychiatry despite offering more promise than stagnant medication development. In 2015, the U.S. National Institute of Mental Health allocated only 5.4% of its budget to new clinical trials of psychotherapies. Medication trials are largely funded by pharmaceutical companies, despite plentiful evidence they can work and that patients are more likely to prefer them. 184. Further critiques have emerged from feminist, constructionist and discourse analytical sources. 185, 186, 187. Key to these is the issue of power. 186, 188. In this regard, there is a concern that clients are persuaded, both inside and outside the consulting room, to understand themselves and their difficulties in ways that are consistent with therapeutic ideas. 176, 186. This means that alternative ideas, example, feminist. 189, economic. 190, spiritual. 191, are sometimes implicitly undermined. 192. Critics suggest that we idealize the situation when we think of therapy only as a helping relationship, arguing instead that it is fundamentally a political practice, in that some cultural ideas and practices are supported while others are undermined or disqualified, and that while it is seldom intended, the therapist-client relationship always participates in society's power relations and political dynamics. 176, 193, 194. A noted academic who espoused this criticism was Michel Foucault. 195. 196, 197. See also. Improving access to psychological therapies, United Kingdom initiative to improve access to psychological therapies. List of psychotherapy journals. Physical therapy, profession that helps a disabled person function in everyday life. Psychosomatic medicine, interdisciplinary medical field exploring various influences on bodily processes. A splint is defined as a rigid or flexible device that maintains in position a displaced or movable part, also used to keep in place and protect an injured part, or as a rigid or flexible material used to protect, immobilize, or restrict motion in a part. 1. Splints can be used for injuries that are not severe enough to immobilize the entire injured structure of the body. For instance, a splint can be used for certain fractures, soft tissue sprains, tendon injuries, or injuries awaiting orthopedic treatment. A splint may be static, not allowing motion, or dynamic, allowing controlled motion. Splints can also be used to relieve pain in damaged joints. Splints are quick and easy to apply and do not require a plastering technique. Splints are often made out of some kind of flexible material and a firm pole-like structure for stability. They often buckle or velcro together. Uses. Capenner finger splint. By the emergency medical services or by volunteer first responders, to temporarily immobilize a fractured limb before transportation. By allied health professionals such as occupational therapists, physiotherapists and orthotists, to immobilize an articulation, e.g. the knee, that can be freed while not standing, e.g. during sleep. By athletic trainers to immobilize an injured bone or joint to facilitate safer transportation of the injured person, or by emergency department, ED, physicians to stabilize fractures or sprains until follow-up appointment with an orthopedist. Types. Illustration of an ankle stirrup splint. Finger splint. Ankle stirrup, used for the ankles. 2. Finger splints, used for the fingers. A mallet or baseball finger is a rupture of the extensor tendon and sometimes including a fracture. While surgery may be necessary, such an injury may heal if placed in a finger splint. 3. Nasal splint. 4. Posterior lower leg. Posterior full leg. Posterior elbow. Sugar tong, used for the forearm or wrist. They are named sugar tong due to their long, U-shaped characteristics, similar to a type of utensil used to pick up sugar cubes. 5. Thumb spica, used for the thumb. 6. Ulnar gutter, used for the forearm to the palm. 7. Volar wrist splint, used for the wrist. 8. Wrist/arm splint, used for the wrist or arm. History. BC to AD. Splinting has been used since ancient times. Evidence suggests that splint usage dates back to 1500 BC that could treat not only fractures but burns as well. Citation needed. These splints were made from materials like leaves, reeds, bamboo, and bark padded with linen and copper. Mummies from Egypt have been uncovered wearing splints from previous injuries that were obtained in their lifetime. Hippocrates, alive from 460 to 377 BC, was very well known for his discoveries and techniques for splinting. He created a distraction splint that was advanced for his time. The splint, made up of leather cuffs that were separated by slim wooden slats, worked to repair the fracture and realign the bones. Around 1000 AD, the use of Hippocrates' splinting technique using plants, like palm branches and cane halves, continued to be practiced. Flour dust, egg whites, and vegetable mixtures were created to form plaster for creating splints. Most splints in ancient times were cast-like and made to immobilize an area of the body. This is illustrated by the Aztecs around 1400 AD. They made splints with leaves, leather, and paste. 1500s. In the early 1500s, gunpowder was introduced to Europe, which caused a serious decline in the market of armor making. Armor makers had to figure out how to make a living with the skills they had already acquired. This led to the creation of braces due to the common use of metal in braces. Armor makers were knowledgeable in areas of the exterior anatomy and joint alignment, making braces the obvious replacement for their armor making. In 1517, after the evolution of the armor trade, injuries were being treated by metal braces secured by screws. Jumping to 1592, the first written piece on splints by surgeon Hieronymus Fabricius shows various drawings of armor-like splints for the entire body. 1700s, 1800s. In the mid-1700s, doctors and mechanics worked with each other to create splints for certain injuries. Surgeons need these mechanics to design and build the splints for them. Most splints were made of metal. Plaster of Paris, a white powdery substance used mostly for casts and molds in the form of a quick-setting paste with water, began to be used for immobilizing splints. This method was not a popular way of splinting as it took too long to dry and suitable fabric was sparse. In the 1800s, it was beginning to be recognized that rehabilitation after an injury was important. Orthopedics started to become a separate field from general surgery. A famous British surgeon, Hugh Owen Thomas, created specialty splints that were cheap and best for injuries that were being rehabilitated. By 1883, mechanics and surgeons separated due to class issues. This created two different areas that shaped the way braces were being created and distributed. Around 1888, F. Gustav Ernst, a dedicated mechanic, released a book illustrating upper body splints. In 1899, orthopedic surgeon Alessandro Codavilla followed suit and published a book explaining the importance of using surgical procedures to set up better results using splints. See also: SAM splint, traction splint, vacuum splint, cervical collar, Kendrick extrication device, long spine board, orthopedic surgery, buddy wrapping, PASG, pneumatic anti-shock garment. A medical device is any device intended to be used for medical purposes. Significant potential for hazards are inherent when using a device for medical purposes, and thus medical devices must be proved safe and effective with reasonable assurance before regulating governments allow marketing of the device in their country. As a general rule, as the associated risk of the device increases, the amount of testing required to establish safety and efficacy also increases. Further, as associated risk increases, the potential benefit to the patient must also increase. Discovery of what would be considered a medical device by modern standards dates as far back as c. 1700 BC in Baluchistan, where Neolithic dentists used flint-tipped drills and bowstrings. 1. Study of archaeology and Roman medical literature also indicate that many types of medical devices were in widespread use during the time of ancient Rome. 2. In the United States, it was not until the Federal Food, Drug, and Cosmetic Act, FDNC Act, in 1938 that medical devices were regulated. Later in 1976, the Medical Device Amendments to the FDNC Act established medical device regulation and oversight as we know it today in the United States. 3. Medical device regulation in Europe as we know it today came into effect in 1993 by what is collectively known as the Medical Device Directive, MDD. On May 26, 2017, the Medical Device Regulation, MDR, replaced the MDD. Medical devices vary in both their intended use and indications for use. Examples range from simple, low-risk devices such as tongue depressors, medical thermometers, disposable gloves, and bedpans to complex, high-risk devices that are implanted and sustain life. One example of high-risk devices are those with embedded software such as pacemakers, and which assist in the conduct of medical testing, implants, and prostheses. The design of medical devices constitutes a major segment of the field of biomedical engineering. The global medical device market was estimated to be between $220 and $250 billion in 2013. The United States controls 40% of the global market, followed by Europe, 25%, Japan, 15%, and the rest of the world, 20%. Although collectively Europe has a larger share, Japan has the second largest country market share. The largest market shares in Europe, in order of market share size, belong to Germany, Italy, France, and the United Kingdom. The rest of the world comprises regions like, in no particular order, Australia, Canada, China, India, and Iran. This article discusses what constitutes a medical device in these different regions, and throughout the article these regions will be discussed in order of their global market share. Definition: medical devices were used for surgery in ancient Rome. A global definition for medical device is difficult to establish because there are numerous regulatory bodies worldwide overseeing the marketing of medical devices. Although these bodies often collaborate and discuss the definition in general, there are subtle differences in wording that prevent a global harmonization of the definition of a medical device, thus the appropriate definition of a medical device depends on the region. Often a portion of the definition of a medical device is intended to differentiate between medical devices and drugs, as the regulatory requirements of the two are different. Definitions also often recognize in vitro diagnostics as a subclass of medical devices and establish accessories as medical devices. Definitions by region. United States, Food and Drug Administration. Section 201(h) of the Federal Food, Drug and Cosmetic (FDNC) Act, 5, defines a device as an instrument, apparatus, implement, machine, contrivance, implant, in vitro reagent, or other similar or related article, including a component part, or accessory which is recognized in the official national formulary, or the United States Pharmacopoeia, or any supplement to them. Intended for use in the diagnosis of disease or other conditions, or in the cure, mitigation, treatment, or prevention of disease, in man or other animals, or intended to affect the structure or any function of the body of man or other animals, and which does not achieve its primary intended purposes through chemical action within or on the body of man or other animals, and which is not dependent upon being metabolized for the achievement of its primary intended purposes. The term device does not include software functions excluded pursuant to Section 520(0). European Union. According to Article 1 of Council Directive 93/42/EEC, 6, medical device means any instrument, apparatus, appliance, software, material or other article, whether used alone or in combination, including the software intended by its manufacturer to be used specifically for diagnostic and/or therapeutic purposes and necessary for its proper application, intended by the manufacturer to be used for human beings for the purpose of diagnosis, prevention, monitoring, treatment or alleviation of disease. Diagnosis, monitoring, treatment, alleviation of or compensation for an injury or handicap. Investigation, replacement or modification of the anatomy or of a physiological process. Control of conception, and which does not achieve its principal intended action in or on the human body by pharmacological, immunological or metabolic means, but which may be assisted in its function by such means. EU legal framework. Based on the new approach, rules that relate to safety and performance of medical devices were harmonized in the EU in the 1990s. The new approach, defined in a European Council resolution of May 1985, 7, represents an innovative way of technical harmonization. It aims to remove technical barriers to trade and dispel the consequent uncertainty for economic operators, to facilitate free movement of goods inside the EU, citation needed. The previous core legal framework consisted of 3 directives. Frowny face citation needed. Directive 90/385/EEC regarding active implantable medical devices. Directive 93/42/EEC regarding medical devices. Directive 98/79/EC regarding in vitro diagnostic medical devices. Until 2022, the In Vitro Diagnosis Regulation, IVDR, will replace the EU's current directive on in vitro diagnostic, 98/79/EC. They aim at ensuring a high level of protection of human health and safety and the good functioning of the single market. These three main directives have been supplemented over time by several modifying and implementing directives, including the last technical revision brought about by Directive 2007/47/EC, 8. The government of each member state must appoint a competent authority responsible for medical devices. 9. The competent authority, CA, is a body with authority to act on behalf of the member state to ensure that member state government transposes requirements of medical device directives into national law and applies them. The CA reports to the Minister of Health in the member state. The CA in one member state has no jurisdiction in any other member state, but exchanges information and tries to reach common positions. In the UK, for example, the Medicines and Healthcare Products Regulatory Agency, MHRA, acted as a CA. In Italy it is the Ministero Salute, Ministry of Health. Medical devices must not be mistaken with medicinal products. In the EU, all medical devices must be identified with the CE mark. The conformity of a medium or high-risk medical device with relevant regulations is also assessed by an external entity, the notified body, before it can be placed on the market. In September 2012, the European Commission proposed new legislation aimed at enhancing safety, traceability, and transparency. 10. The regulation was adopted in 2017. The future core legal framework consists of two regulations, replacing the previous three directives. The Medical Devices Regulation, MDR, EU, 2017/745. The In Vitro Diagnostic Medical Devices Regulation, IVDR, EU, 2017/746. Japan. Article 2, Paragraph 4, of the Pharmaceutical Affairs Law, PAL, 11, defines medical devices as instruments and apparatus intended for use in diagnosis, cure or prevention of diseases in humans or other animals, intended to affect the structure or functions of the body of man or other animals. Rest of the world. Canada. Bags of medical supplies and defibrillators at the York Region EMS Logistics Headquarters in Ontario, Canada. The term medical device, as defined in the Food and Drugs Act, is any article, instrument, apparatus, or contrivance, including any component, part or accessory thereof, manufactured, sold or represented for use in the diagnosis, treatment, mitigation or prevention of a disease, disorder or abnormal physical state, or its symptoms, in a human being, the restoration, correction or modification of a body function or the body structure of a human being, the diagnosis of pregnancy in a human being, or the care of a human being during pregnancy and at and after the birth of a child, including the care of the child. It also includes a contraceptive device but does not include a drug. 12. The term covers a wide range of health or medical instruments used in the treatment, mitigation, diagnosis or prevention of a disease or abnormal physical condition. Health Canada reviews medical devices to assess their safety, effectiveness, and quality before authorizing their sale in Canada. 13. According to the Act, medical device does not include any device that is intended for use in relation to animals. 14. India. This section does not cite any sources. Please help improve this section by adding citations to reliable sources. Unsourced material may be challenged and removed. June 2022, learn how and when to remove this template message. There is no specific definition of the term medical devices in Indian law. However, certain medical devices are notified as drugs under the Drugs and Cosmetics Act. Section 3(b)(4), relating to definition of drugs holds that devices intended for internal or external use in the diagnosis, treatment, mitigation or prevention of disease or disorder in human beings or animals are also drugs. 15. As of April 2022, 14 classes of devices are classified as drugs. Regulation and oversight. Risk classification. A stethoscope, US FDA Product Code BZS, a popular Class 1 medical device as determined by the US FDA, ubiquitous in hospitals. The regulatory authorities recognize different classes of medical devices based on their potential for harm if misused, design complexity, and their use characteristics. Each country or region defines these categories in different ways. The authorities also recognize that some devices are provided in combination with drugs, and regulation of these combination products takes this factor into consideration. Classifying medical devices based on their risk is essential for maintaining patient and staff safety while simultaneously facilitating the marketing of medical products. By establishing different risk classifications, lower-risk devices, for example, a stethoscope or tongue depressor, are not required to undergo the same level of testing that higher-risk devices such as artificial pacemakers undergo. Establishing a hierarchy of risk classification allows regulatory bodies to provide flexibility when reviewing medical devices. Citation needed. Classification by region. United States. Main article, Medical Device Manufacturing. Further information, Federal Food, Drug, and Cosmetic Act Medical Devices. This section duplicates the scope of other articles, specifically medical device manufacturing. Please discuss this issue on the talk page and edit it to conform with Wikipedia's Manual of Style by replacing the section with a link and a summary of the repeated material or by spinning off the repeated text into an article in its own right. March 2019. Under the Food, Drug, and Cosmetic Act, the U.S. Food and Drug Administration recognizes 3 classes of medical devices, based on the level of control necessary to assure safety and effectiveness. 16. Class 1. Class 2. Class 3. Device Class Risk FDA Regulatory Control Examples. Class 1 Low Risk General Controls Tongue, electric toothbrush, bandages, hospital beds. Class 2 Medium Risk General Controls plus Pre-Market Notification, 510K, catheters, contact lenses, pregnancy test kits. Class 3 High Risk General Controls plus Special Controls, 510K, plus Pre-Market Approval, PMA, pacemakers, defibrillators, implanted prosthetics, breast implants. The classification procedures are described in the Code of Federal Regulations, Title 21, Part 860, usually known as 21 CFR 860.17. Class 1 devices are subject to the least regulatory control and are not intended to help support or sustain life or be substantially important in preventing impairment to human health, and may not present an unreasonable risk of illness or injury. 18. Examples of Class 1 devices include elastic bandages, examination gloves, and handheld surgical instruments. 19. Class 2 devices are subject to special labeling requirements, mandatory performance standards and post-market surveillance. 19. Examples of Class 2 devices include acupuncture needles, powered wheelchairs, infusion pumps, air purifiers, surgical drapes, stereotaxic navigation systems, and surgical robots. 16, 19, 20, 21, 22. Class 3 devices are usually those that support or sustain human life, are of substantial importance in preventing impairment of human health, or present a potential, unreasonable risk of illness or injury and require pre-market approval. 19, 16. Examples of Class 3 devices include implantable pacemakers, pulse generators, HIV diagnostic tests, automated external defibrillators, and endosseous implants. 19. European Union (EU) and European Free Trade Association (EFTA). The classification of medical devices in the European Union is outlined in Article 9 of the Council Directive 93/42/EEC and Annex 8 of the EU Medical Device Regulation. There are basically 4 classes, ranging from low risk to high risk, classes I, IIA, IIB, and 3. This excludes in vitro diagnostics including software, which fall in 4 classes, from A, lowest risk, to D, highest risk. 23. Device class risk examples. Class 1, Class 1, Class IS, Class IM, Class IR, low risk tongue, wheelchair, spectacles. Class IIA medium risk hearing aids. Class IIB medium to high risk ventilators, infusion pumps. Class 3 high risk pacemakers, defibrillators, implanted prosthetics, breast implants. Class 1 devices, non-invasive, everyday devices or equipment. Class 1 devices are generally low risk and can include bandages, compression hosiery, or walking aids. Such devices require only for the manufacturer to complete a technical file. Class IS devices. Class IS devices are similarly non-invasive devices, however this subgroup extends to include sterile devices. Examples of Class IS devices include stethoscopes, examination gloves, colostomy bags, or oxygen masks. These devices also require a technical file, with the added requirement of an application to a European notified body for certification of manufacturing in conjunction with sterility standards. Class IM devices, this refers chiefly to similarly low-risk measuring devices. Included in this category are thermometers, droppers, and non-invasive blood pressure measuring devices. Once again, the manufacturer must provide a technical file and be certified by a European notified body for manufacturing in accordance with metrology regulations. Class IIA devices. Class IIA devices generally constitute low to medium risk and pertain mainly to devices installed within the body in the short term. Class IIA devices are those which are installed within the body for only between 60 minutes and 30 days. Examples include hearing aids, blood transfusion tubes, and catheters. Requirements include technical files and a conformity test carried out by a European notified body. Class IIB devices, slightly more complex than IIA devices. Class IIB devices are generally medium to high risk and will often be devices installed within the body for periods of 30 days or longer. Examples include ventilators and intensive care monitoring equipment. Identical compliance route to Class IIA devices with an added requirement of a device type examination by a notified body. Class 3 devices. Class 3 devices are strictly high-risk devices. Examples include balloon catheters, prosthetic heart valves, pacemakers, etc. The steps to approval here include a full quality assurance system audit, along with examination of both the device's design and the device itself by a European notified body. The authorization of medical devices is guaranteed by a declaration of conformity. This declaration is issued by the manufacturer itself, but for products in Class IM, IR, IIA, IIB or 3, it must be verified by a certificate of conformity issued by a notified body. A notified body is a public or private organization that has been accredited to validate the compliance of the device to the European directive. Medical devices that pertain to Class I, on condition they do not require sterilization or do not measure a function, can be marketed purely by self-certification. The European classification depends on rules that involve the medical device's duration of body contact, invasive character, use of an energy source, effect on the central circulation or nervous system, diagnostic impact, or incorporation of a medicinal product. Certified medical devices should have the CE mark on the packaging, insert leaflets, etc. These packagings should also show harmonized pictograms and EN standardized logos to indicate essential features such as instructions for use, expiry date, manufacturer, sterile, don't reuse, etc. In November 2018, the Federal Administrative Court of Switzerland decided that the Sympto app, used to analyze a woman's menstrual cycle, was a medical device because it calculates a fertility window for each woman using personal data. The manufacturer, Symptotherm Foundation, argued that this was a didactic, not a medical process. The court laid down that an app is a medical device if it is to be used for any of the medical purposes provided by law, and creates or modifies health information by calculations or comparison, providing information about an individual patient. 24. Japan. Medical devices, excluding in vitro diagnostics, in Japan are classified into 4 classes based on risk. Frowny face 11. Device class risk. Class 1 insignificant. Class 2 low. Class 3 high risk on malfunction. Class 4 high risk could cause life-threatening. Classes 1 and 2 distinguish between extremely low and low-risk devices. Classes 3 and 4, moderate and high risk respectively, are highly and specially controlled medical devices. In vitro diagnostics have 3 risk classifications. 25. Rest of the world. For the remaining regions in the world, the risk classifications are generally similar to the United States, European Union, and Japan, or are a variant combining 2 or more of the 3 countries' risk classifications. Citation needed. Australia. The classification of medical devices in Australia is outlined in Section 41BD of the Therapeutic Goods Act 1989 and Regulation 3.2 of the Therapeutic Goods Regulations 2002, under control of the Therapeutic Goods Administration. Similarly to the EU classification, they rank in several categories, by order of increasing risk and associated required level of control. Various rules identify the device's category. 26. Medical device categories in Australia. Classification level of risk. Class 1 low. Class 1 measuring or Class 1 supplied sterile or Class IIA low, medium. Class IIB medium, high. Class 3 high. Active implantable medical devices, AIMD, high. Canada. Stretchers wait to be used at the York Region EMS Logistics Headquarters in Ontario. The Medical Devices Bureau of Health Canada recognizes 4 classes of medical devices based on the level of control necessary to assure the safety and effectiveness of the device. Class 1 devices present the lowest potential risk and do not require a license. Class 2 devices require the manufacturer's declaration of device safety and effectiveness, whereas Class 3 and 4 devices present a greater potential risk and are subject to in-depth scrutiny. 13. A guidance document for device classification is published by Health Canada. 27. Canadian classes of medical devices correspond to the European Council Directive 93/42/EEC, MDD, devices frowny face. 27. Class 1, Canada, generally corresponds to Class 1, ECD. Class 2, Canada, generally corresponds to Class IIA, ECD. Class 3, Canada, generally corresponds to Class IIB, ECD. Class 4, Canada, generally corresponds to Class 3, ECD. Examples include surgical instruments, Class 1, contact lenses and ultrasound scanners, Class 2, orthopedic implants and hemodialysis machines, Class 3, and cardiac pacemakers, Class 4. 28. India. Medical devices in India are regulated by Central Drug Standard Control Organisation, CDSCO. Medical devices under the Medical Devices Rules, 2017 are classified as per Global Harmonization Task Force, GHTF, based on associated risks. The CDSCO classifications of medical devices govern alongside the regulatory approval and registration by the CDSCO is under the DCGI. Every single medical device in India pursues a regulatory framework that depends on the drug guidelines under the Drug and Cosmetics Act, 1940, and the Drugs and Cosmetics runs under 1945. CDSCO classification for medical devices has a set of risk classifications for numerous products planned for notification and guidelines as medical devices. Citation needed. Device class risk examples. Class A low-risk tongue, wheelchair, spectacles, alcohol swab. Class B low to moderate risk hearing aids, thermometer. Class C moderate to high-risk ventilators, infusion pumps. Class D high-risk pacemakers, defibrillators, implanted prosthetics, breast implants. Iran. See also, cancer diagnostic probe. Iran produces about 2,000 types of medical devices and medical supplies, such as appliances, dental supplies, disposable sterile medical items, laboratory machines, various biomaterials and dental implants. 400 medical products are produced at the C and D risk class, with all of them licensed by the Iranian Health Ministry in terms of safety and performance based on EU standards. Some Iranian medical devices are produced according to the European Union standards. Some producers in Iran export medical devices and supplies which adhere to European Union standards to applicant countries, including 40 Asian and European countries. Some Iranian producers export their products to foreign countries. 29. Validation and verification. Main article, Validation and verification, medical devices. Validation and verification of medical devices ensure that they fulfill their intended purpose. Validation or verification is generally needed when a health facility acquires a new device to perform medical tests. Citation needed. The main difference between the two is that validation is focused on ensuring that the device meets the needs and requirements of its intended users and the intended use environment, whereas verification is focused on ensuring that the device meets its specified design requirements. Citation needed. Standardization and regulatory concerns. The ISO standards for medical devices are covered by ICS 11.100.20 and 11.040.01, 30, 31. The quality and risk management regarding the topic for regulatory purposes is convened by ISO 13485 and ISO 14971. ISO 13485:2016 is applicable to all providers and manufacturers of medical devices, components, contract services and distributors of medical devices. The standard is the basis for regulatory compliance in local markets, and most export markets. 32, 33, 34. Additionally, ISO 9001:2008 sets precedents because it signifies that a company engages in the creation of new products. It requires that the development of manufactured products have an approval process and a set of rigorous quality standards and development records before the product is distributed. 35. Further standards are IEC 60601-1, which is for electrical devices, mains-powered as well as battery-powered, EN 45502-1, which is for active implantable medical devices, and IEC 62304 for medical software. The US FDA also published a series of guidances for industry regarding this topic against 21 CFR 820 Subchapter H, Medical Devices. 36. Subpart B includes quality system requirements, an important component of which are design controls, 21 CFR 820.30. To meet the demands of these industry regulation standards, a growing number of medical device distributors are putting the complaint management process at the forefront of their quality management practices. This approach further mitigates risks and increases visibility of quality issues. 37. Starting in the late 1980s, 38. The FDA increased its involvement in reviewing the development of medical device software. The precipitant for change was a radiation therapy device, Therac 25, that overdosed patients because of software coding errors. 39. FDA is now focused on regulatory oversight on medical device software development process and system-level testing. 40. A 2011 study by Diana Zuckerman and Paul Brown of the National Center for Health Research and Dr. Stephen Neeson of the Cleveland Clinic, published in the Archives of Internal Medicine, showed that most medical devices recalled in the last 5 years for serious health problems or death had been previously approved by the FDA using the less stringent, and cheaper, 510(k) process. In a few cases, the devices had been deemed so low risk that they did not undergo any FDA regulatory review. Of the 113 devices recalled, 35 were for cardiovascular issues. 41. This study was the topic of congressional hearings reevaluating FDA procedures and oversight. A 2014 study by Diana Zuckerman, Paul Brown, and Dr. Aditi Das of the National Center for Health Research, published in JAMA Internal Medicine, examined the scientific evidence that is publicly available about medical implants that were cleared by the FDA 510(k) process from 2008 to 2012. They found that scientific evidence supporting substantial equivalence to other devices already on the market was required by law to be publicly available, but the information was available for only 16% of the randomly selected implants, and only 10% provided clinical data. Of the more than 1,100 predicate implants that the new implants were substantially equivalent to, only 3% had any publicly available scientific evidence, and only 1% had clinical evidence of safety or effectiveness. 42. The researchers concluded that publicly available scientific evidence on implants was needed to protect the public health. Citation needed. In 2014 to 2015, a new international agreement, the Medical Device Single Audit Program, MDSAP, was put in place with 5 participant countries: Australia, Brazil, Canada, Japan, and the United States. The aim of this program was to develop a process that allows a single audit or inspection to ensure the medical device regulatory requirements for all 5 countries are satisfied. 43. In 2017, a study by Dr. J. Ronquillo and Dr. Diana Zuckerman published in the peer-reviewed policy journal Millbank Quarterly found that electronic health records and other device software were recalled due to life-threatening flaws. The article pointed out the lack of safeguards against hacking and other cybersecurity threats, stating current regulations are necessary but not sufficient for ensuring patient safety by identifying and eliminating dangerous defects in software currently on the market. 44. They added that legislative changes resulting from the law entitled the 21st Century Cures Act will further deregulate health IT, reducing safeguards that facilitate the reporting and timely recall of flawed medical software that could harm patients. A study by Dr. Stephanie Fox Rawlings and colleagues at the National Center for Health Research, published in 2018 in the policy journal Millbank Quarterly, investigated whether studies reviewed by the FDA for high-risk medical devices are proven safe and effective for women, minorities, or patients over 65 years of age. 45. The law encourages patient diversity in clinical trials submitted to the FDA for review, but does not require it. The study determined that most high-risk medical devices are not tested and analyzed to ensure that they are safe and effective for all major demographic groups, particularly racial and ethnic minorities and people over 65. Therefore, they do not provide information about safety or effectiveness that would help patients and physicians make well-informed decisions. In 2018, an investigation involving journalists across 36 countries coordinated by the International Consortium of Investigative Journalists, ICIJ, prompted calls for reform in the United States, particularly around the 510K substantial equivalence process. Wink with a frown. 46. The investigation prompted similar calls in the UK and Europe Union. 47. Packaging standards. Curette in sterile pouch. Porous Tyvek material allows gas sterilization. Medical device packaging is highly regulated. Often medical devices and products are sterilized in the package. 48. Sterility must be maintained throughout distribution to allow immediate use by physicians. A series of special packaging tests measure the ability of the package to maintain sterility. Relevant standards include ASTM F2097, Standard Guide for Design and Evaluation of Primary Flexible Packaging for Medical Products. ASTM F2475-11, Standard Guide for Biocompatibility Evaluation of Medical Device Packaging Materials. 49. EN 868 Packaging Materials and Systems for Medical Devices to be Sterilized, General Requirements and Test Methods. ISO 11607 Packaging for Terminally Sterilized Medical Devices. Package testing is part of a quality management system including verification and validation. It is important to document and ensure that packages meet regulations and end-use requirements. Manufacturing processes must be controlled and validated to ensure consistent performance. 50. 51. EN ISO 15223-1 defines symbols that can be used to convey important information on packaging and labeling. Biocompatibility standards. ISO 10993, Biological Evaluation of Medical Devices. Cleanliness standards. Medical device cleanliness has come under greater scrutiny since 2000, when Sulzer Orthopedics recalled several thousand metal hip implants that contained a manufacturing residue. 52. Based on this event, ASTM established a new task group, F04.15.17, for established test methods, guidance documents, and other standards to address cleanliness of medical devices. This task group has issued 2 standards for permanent implants to date. 1. ASTM F2459, Standard Test Method for Extracting Residue from Metallic Medical Components and Quantifying via Gravimetric Analysis. 53. 2. ASTM F2847, Standard Practice for Reporting and Assessment of Residues on Single-Use Implants. 54. 3. ASTM F3172, Standard Guide for Validating Cleaning Processes Used During the Manufacture of Medical Devices. 55. In addition, the cleanliness of reusable devices has led to a series of standards, including ASTM E2314, Standard Test Method for Determination of Effectiveness of Cleaning Processes for Reusable Medical Instruments Using a Microbiologic Method, Simulated Use Test. 56. ASTM D7225, Standard Guide for Blood Cleaning Efficiency of Detergents and Washer Disinfectors. 57. ASTM F3208, Standard Guide for Selecting Test Soils for Validation of Cleaning Methods for Reusable Medical Devices. 55. The ASTM F04.15.17 task group is working on several new standards that involve designing implants for cleaning, selection and testing of brushes for cleaning reusable devices, and cleaning assessment of medical devices made by additive manufacturing. 58. Additionally, the FDA is establishing new guidelines for reprocessing reusable medical devices, such as orthoscopic shavers, endoscopes, and suction tubes. 59. New research was published in ACS Applied Interfaces and Material to Keep Medical Tools Pathogen-Free. 60. Safety Standards. Main article, Safety Standards. Design, Prototyping, and Product Development. Main article, Medical Device Manufacturing. Medical device manufacturing requires a level of process control according to the classification of the device. Higher risk, more controls. When in the initial R&D phase, manufacturers are now beginning to design for manufacturability. This means products can be more precision engineered for production to result in shorter lead times, tighter tolerances and more advanced specifications and prototypes. These days, with the aid of CAD or modeling platforms, the work is now much faster, and this can act also as a tool for strategic design generation as well as a marketing tool. 61. Failure to meet cost targets will lead to substantial losses for an organization. In addition, with global competition, the R&D of new devices is not just a necessity, it is an imperative for medical device manufacturers. The realization of a new design can be very costly, especially with the shorter product life cycle. As technology advances, there is typically a level of quality, safety and reliability that increases exponentially with time. 61. For example, initial models of the artificial cardiac pacemaker were external support devices that transmits pulses of electricity to the heart muscles via electrode leads on the chest. The electrodes contact the heart directly through the chest, allowing stimulation pulses to pass through the body. Recipients of this typically developed an infection at the entrance of the electrodes, which led to the subsequent trial of the first internal pacemaker, with electrodes attached to the myocardium by thoracotomy. Future developments led to the isotope power source that would last for the lifespan of the patient. Page needed. Software. Main article, Medical Software. Mobile Medical Applications. With the rise of smartphone usage in the medical space, in 2013, the FDA issued to regulate mobile medical applications and protect users from their unintended use, soon followed by European and other regulatory agencies. This guidance distinguishes the apps subjected to regulation based on the marketing claims of the apps. 62. Incorporation of the guidelines during the development phase of such apps can be considered as developing a medical device. The regulations have to adapt and propositions for expedite approval may be required due to the nature of versions of mobile application development. 63. 64. On September 25, 2013, the FDA released a draft guidance document for regulation of mobile medical applications, to clarify what kind of mobile apps related to health would not be regulated, and which would be. 65. 66. Cybersecurity. Further information, medical device hijack. Medical devices such as pacemakers, insulin pumps, operating room monitors, defibrillators, and surgical instruments, including deep brain stimulators, can incorporate the ability to transmit vital health information from a patient's body to medical professionals. 67. Some of these devices can be remotely controlled. This has engendered concern about privacy and security issues. 68. 69. Human error and technical glitches with this technology. While only a few studies have looked at the susceptibility of medical devices to hacking, there is a risk. 70. 71. 72. In 2008, computer scientists proved that pacemakers and defibrillators can be hacked wirelessly via radio hardware, an antenna, and a personal computer. 73. 74. 75. These researchers showed they could shut down a combination heart defibrillator and pacemaker and reprogram it to deliver potentially lethal shocks or run out its battery. Jay Radcliffe, a security researcher interested in the security of medical devices, raised fears about the safety of these devices. He shared his concerns at the Black Hat Security Conference. 76. Radcliffe fears that the devices are vulnerable and has found that a lethal attack is possible against those with insulin pumps and glucose monitors. Some medical device makers downplay the threat from such attacks and argue that the demonstrated attacks have been performed by skilled security researchers and are unlikely to occur in the real world. At the same time, other makers have asked software security experts to investigate the safety of their devices. 77. As recently as June 2011, security experts showed that by using readily available hardware and a user manual, a scientist could both tap into the information on the system of a wireless insulin pump in combination with a glucose monitor. With the pin of the device, the scientist could wirelessly control the dosage of the insulin. 78. Anand Raghunathan, a researcher in this study, explains that medical devices are getting smaller and lighter so that they can be easily worn. The downside is that additional security features would put an extra strain on the battery and size and drive up prices. Dr. William Maisel offered some thoughts on the motivation to engage in this activity. Motivation to do this hacking might include acquisition of private information for financial gain or competitive advantage, damage to a device manufacturer's reputation, sabotage, intent to inflict financial or personal injury, or just satisfaction for the attacker. 79. Researchers suggest a few safeguards. One would be to use rolling codes. Another solution is to use a technology called body-coupled communication that uses the human skin as a waveguide for wireless communication. On December 28, 2016, the U.S. Food and Drug Administration released its recommendations that are not legally enforceable for how medical device manufacturers should maintain the security of Internet-connected devices. 80. 81. Similar to hazards, cybersecurity threats and vulnerabilities cannot be eliminated but must be managed and reduced to a reasonable level. 82. When designing medical devices, the tier of cybersecurity risk should be determined early in the process in order to establish a cybersecurity vulnerability and management approach, including a set of cybersecurity design controls. The medical device design approach employed should be consistent with the NIST cybersecurity framework for managing cybersecurity-related risks. In August 2013, the FDA released over 20 regulations aiming to improve the security of data in medical devices. 83. In response to the growing risks of limited cybersecurity. Artificial intelligence. The number of approved medical devices using artificial intelligence or machine learning, AI or ML, is increasing. As of 2020, there were several hundred AI or ML medical devices approved by the US FDA or CE marked devices in Europe. 84, 85, 86. Most AI or ML devices focus upon radiology. As of 2020, there was no specific regulatory pathway for AI/ML-based medical devices in the US or Europe. 87, 85, 86. However, in January 2021, the FDA published a proposed regulatory framework for AI/ML-based software. 88, 89, and the EU Medical Device Regulation, which replaces the EU Medical Device Directive in May 2021, defines regulatory requirements for medical devices, including AI or ML software. 90. Medical equipment. Types. There are several basic types. Diagnostic equipment includes medical imaging machines, used to aid in diagnosis. Examples are ultrasound and MRI machines, PET and CT scanners, and X-ray machines. Treatment equipment includes infusion pumps, medical lasers and LASIK surgical machines. Life support equipment is used to maintain a patient's bodily function. This includes medical ventilators, incubators, anesthetic machines, heart-lung machines, ECMO, and dialysis machines. Medical monitors allow medical staff to measure a patient's medical state. Monitors may measure patient vital signs and other parameters including ECG, EEG, and blood pressure. Medical laboratory equipment automates or helps analyze blood, urine, genes, and dissolved gases in the blood. Diagnostic medical equipment may also be used in the home for certain purposes, e.g. for the control of diabetes mellitus, such as in the case of continuous glucose monitoring. Therapeutic, physical therapy machines like continuous passive range of motion, CPM, machines. Air purifying equipment may be used in the periphery of the operating room, 92, or at point sources including near the surgical site for the removal of surgical plume, 93. The identification of medical devices has been recently improved by the introduction of Unique Device Identification, UDI, and standardized naming using the Global Medical Device Nomenclature, GMDN, which have been endorsed by the International Medical Device Regulatory Forum, IMDRF. 94. A biomedical equipment technician, BMET, is a vital component of the healthcare delivery system. Employed primarily by hospitals, METs are the people responsible for maintaining a facility's medical equipment. BMET mainly act as an interface between doctor and equipment. Medical equipment donation. There are challenges surrounding the availability of medical equipment from a global health perspective, with low-resource countries unable to obtain or afford essential and life-saving equipment. In these settings, well-intentioned equipment donation from high to low-resource settings is a frequently used strategy to address this through individuals, organizations, manufacturers, and charities. However, issues with maintenance, availability of biomedical equipment technicians, BMET, supply chains, user education, and the appropriateness of donations means these frequently fail to deliver the intended benefits. The WHO estimates that 95% of medical equipment in low and middle-income countries, MICs, is imported and 80% of it is funded by international donors or foreign governments. While up to 70% of medical equipment in sub-Saharan Africa is donated, only 10% to 30% of donated equipment becomes operational. 95. A review of current practice and guidelines for the donation of medical equipment for surgical and anesthesia care in LMICs has demonstrated a high level of complexity within the donation process and numerous shortcomings. Greater collaboration and planning between donors and recipients is required together with evaluation of donation programs and concerted advocacy to educate donors and recipients on existing equipment donation guidelines and policies. 96. The circulation of medical equipment is not limited to donations. The rise of reuse and recycle-based solutions, where gently used medical equipment is donated and redistributed to communities in need, is another form of equipment distribution. An interest in reusing and recycling emerged in the 1980s when the potential health hazards of medical waste on the East Coast beaches became highlighted by the media. 97, connecting the large demand for medical equipment and single-use medical devices, with a need for waste reduction, as well as the problem of unequal access for low-income communities, led to the Congress enacting the Medical Waste Tracking Act of 1988. 98. Medical equipment can be donated either by governments or non-governmental organizations, domestic or international. 99. Donated equipment ranges from bedside assistance to radiological equipment. Medical equipment donation has come under scrutiny with regard to donated device failure and loss of warranty in the case of previous ownership. Most medical devices and production company warranties do not extend to reused or donated devices, or to devices donated by initial owners/patients. Such reuse raises matters of patient autonomy, medical ethics, and legality. 99. Such concerns conflict with the importance of equal access to healthcare resources, and the goal of serving the greatest good for the greatest number. 100. Academic resources. Medical and Biological Engineering and Computing Journal. Expert Review of Medical Devices Journal. University-based research, Packaging Institutes. University of Minnesota Medical Devices Center, MDC. University of Strathclyde, Strathclyde Institute of Medical Devices, SIMD. Flinders University Medical Device Research Institute, MDRI. Michigan State University School of Packaging, SOP, 101. IIT Bombay Biomedical Engineering and Technology, Incubation, Center, BETC. See also. Assistive Technology. Clinical Engineer. Design History File. Durable Medical Equipment. Electromagnetic Compatibility. Electronic Health Record. Federal Institute for Drugs and Medical Devices. GHTF. Health Level 7. Home Medical Equipment. Instruments used in general medicine. List of common EMC test standards. Medical grade silicone. Medical logistics. Medical technology. Pharmacopoeia. Safety engineer. Telemedicine. A biopharmaceutical, also known as a biological medical product, or biologic, is any pharmaceutical drug product manufactured in, extracted from, or semi-synthesized from biological sources. Different from totally synthesized pharmaceuticals, they include vaccines, whole blood components, allergenics, somatic cells, gene therapies, tissues, recombinant therapeutic protein, and living medicines used in cell therapy. Biologics can be composed of sugars, proteins, nucleic acids, or complex combinations of these substances, or may be living cells or tissues. They, or their precursors or components, are isolated from living sources: human, animal, plant, fungal, or microbial. They can be used in both human and animal medicine. 2. 3. Terminology surrounding biopharmaceuticals varies between groups and entities, with different terms referring to different subsets of therapeutics within the general biopharmaceutical category. Some regulatory agencies use the terms biological medicinal products or therapeutic biological product to refer specifically to engineered macromolecular products like protein and nucleic acid-based drugs, distinguishing them from products like blood components, or vaccines, which are usually extracted directly from a biological source. 4. 5. 6. Biopharmaceutics is pharmaceutics that works with biopharmaceuticals. Biopharmacology is the branch of pharmacology that studies biopharmaceuticals. Specialty drugs, a recent classification of pharmaceuticals, are high-cost drugs that are often biologics. 7. 8. 9. The European Medicines Agency uses the term advanced therapy medicinal products, ATMPs, for medicines for human use that are based on genes, cells, or tissue engineering. 10. Including gene therapy medicines, somatic cell therapy medicines, tissue-engineered medicines, and combinations thereof. 11. Within EMA contexts, the term advanced therapies refers specifically to ATMPs, although that term is rather nonspecific outside those contexts. Gene-based and cellular biologics, for example, often are at the forefront of biomedicine and biomedical research, and may be used to treat a variety of medical conditions for which no other treatments are available. 12. In some jurisdictions, biologics are regulated via different pathways from other small molecule drugs and medical devices. 13. Major classes. Blood plasma is a type of biopharmaceutical directly extracted from living systems. Extracted from living systems. Some of the oldest forms of biologics are extracted from the bodies of animals, and other humans especially. Important biologics include frowny face citation needed, whole blood and other blood components, organ transplantation and tissue transplants, stem cell therapy, antibodies for passive immunity, example, to treat a virus infection, human reproductive cells, human breast milk, fecal microbiota. Some biologics that were previously extracted from animals, such as insulin, are now more commonly produced by recombinant DNA. Produced by recombinant DNA. See also, biologics for immunosuppression. Biologics can refer to a wide range of biological products in medicine. However, in most cases, the term is used more restrictively for a class of therapeutics, either approved or in development, that are produced using biological processes involving recombinant DNA technology. These medications are usually one of three types. Substances that are, nearly, identical to the body's key signaling proteins. Examples are the blood production stimulating protein erythropoietin, or the growth-stimulating hormone named growth hormone or biosynthetic human insulin and its analogues. Monoclonal antibodies. These are similar to the antibodies that the human immune system uses to fight off bacteria and viruses, but they are custom-designed, using hybridoma technology or other methods, and can therefore be made specifically to counteract or block any given substance in the body, or to target any specific cell type. Examples of such monoclonal antibodies for use in various diseases are given in the table below. Receptor constructs, fusion proteins, usually based on a naturally occurring receptor linked to the immunoglobulin frame. In this case, the receptor provides the construct with detailed specificity, whereas the immunoglobulin structure imparts stability and other useful features in terms of pharmacology. Some examples are listed in the table below. Biologics as a class of medications in this narrower sense have had a profound impact on many medical fields, primarily rheumatology and oncology, but also cardiology, dermatology, gastroenterology, neurology, and others. In most of these disciplines, biologics have added major therapeutic options for treating many diseases, including some for which no effective therapies were available, and others where previously existing therapies were inadequate. However, the advent of biologic therapeutics has also raised complex regulatory issues, see below, and significant pharmacoeconomic concerns because the cost for biologic therapies has been dramatically higher than for conventional, pharmacological, medications. This factor has been particularly relevant since many biological medications are used to treat chronic diseases, such as rheumatoid arthritis or inflammatory bowel disease, or for the treatment of otherwise untreatable cancer during the remainder of life. The cost of treatment with a typical monoclonal antibody therapy for relatively common indications is generally in the range of €7,000–14,000 per patient per year. Older patients who receive biologic therapy for diseases such as rheumatoid arthritis, psoriatic arthritis, or ankylosing spondylitis are at increased risk for life-threatening infection, adverse cardiovascular events, and malignancy. 14. The first such substance approved for therapeutic use was biosynthetic human insulin made via recombinant DNA. Sometimes referred to as Re, under the trade name Humulin, was developed by Genentech, but licensed to Eli Lilly and Company, who manufactured and marketed it starting in 1982. Major kinds of biopharmaceuticals include blood factors, factor VIII and factor IX, thrombolytic agents, tissue plasminogen activator, hormones, insulin, glucagon, growth hormone, gonadotrophins, hematopoietic growth factors, erythropoietin, colony-stimulating factors, interferons, interferon alpha, beta, gamma, interleukin-based products, interleukin-2, vaccines, hepatitis B surface antigen, monoclonal antibodies, various additional products, tumor necrosis factor, therapeutic enzymes. Research and development investment in new medicines by the biopharmaceutical industry stood at $65.2 billion in 2008. 15. A few examples of biologics made with recombinant DNA technology include USIN/INN trade name indication technology mechanism of action. Abatacept aurantia rheumatoid arthritis immunoglobulin CTLA-4 fusion protein T-cell deactivation. adalimumab humoral rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, psoriasis, ulcerative colitis, Crohn's disease monoclonal antibody TNF antagonist. Alefaceptamiviv chronic plaque psoriasis immunoglobulin G1 fusion protein incompletely characterized. Erythropoietin epigen anemia arising from cancer chemotherapy, chronic renal failure, etc. Recombinant protein stimulation of red blood cell production. Etanercept enbrol rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, psoriasis recombinant human TNF receptor fusion protein TNF antagonist. Infliximab Remicade rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, psoriasis, ulcerative colitis, Crohn's disease monoclonal antibody TNF antagonist. Trastuzumab Herceptin breast cancer humanized monoclonal antibody HER2/neu, ERB2, antagonist. Ustekinumab Stelara psoriatic arthritis, psoriasis, ulcerative colitis, Crohn's disease humanized monoclonal antibody IL-12 and IL-23 antagonist. Denileukin diphthitox ontac cutaneous T-cell lymphoma, CTCL, diphtheria toxin engineered protein combining interleukin-2 and diphtheria toxin interleukin-2 receptor binder. Golimumab simponi rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, ulcerative colitis monoclonal antibody TNF antagonist. Vedolizumab Entyvio ulcerative colitis monoclonal antibody A4B7 integrin blocker. Vaccines. Main article, vaccine. Many vaccines are grown in tissue cultures. Gene therapy. Viral gene therapy involves artificially manipulating a virus to include a desirable piece of genetic material. Biosimilars. Main article, biosimilar. With the expiration of many patents for blockbuster biologics between 2012 and 2019, the interest in biosimilar production, i.e., follow-on biologics, has increased, 16, compared to small molecules that consist of chemically identical active ingredients. Biologics are vastly more complex and consist of a multitude of subspecies. Due to their heterogeneity and the high process sensitivity, originators and follow-on biosimilars will exhibit variability in specific variants over time. The safety and clinical performance of both originator and biosimilar biopharmaceuticals must remain equivalent throughout their life cycle. 17, 18. Process variations are monitored by modern analytical tools, example, liquid chromatography, immunoassays, mass spectrometry, etc., and describe a unique design space for each biologic. Citation needed. Biosimilars require a different regulatory framework compared to small molecule generics. Legislation in the 21st century has addressed this by recognizing an intermediate ground of testing for biosimilars. The filing pathway requires more testing than for small molecule generics, but less testing than for registering completely new therapeutics. 19. In 2003, the European Medicines Agency introduced an adapted pathway for biosimilars, termed similar biological medicinal products. This pathway is based on a thorough demonstration of comparability of the product to an existing approved product. 20. Within the United States, the Patient Protection and Affordable Care Act of 2010 created an abbreviated approval pathway for biological products shown to be biosimilar to, or interchangeable with, an FDA-licensed reference biological product. 19. 21. Researchers are optimistic that the introduction of biosimilars will reduce medical expenses to patients and the healthcare system. 16. Commercialization. When a new biopharmaceutical is developed, the company will typically apply for a patent, which is a grant to exclusive manufacturing rights. This is the primary means by which the drug developer can recover the investment cost for development of the biopharmaceutical. The patent laws in the United States and Europe differ somewhat on the requirements for a patent, with the European requirements perceived as more difficult to satisfy. The total number of patents granted for biopharmaceuticals has risen significantly since the 1970s. In 1978, the total patents granted was 30. This had climbed to 15,600 in 1995, and by 2001 there were 34,527 patent applications. 22. In 2012 the U.S. had the highest IP, intellectual property, generation within the biopharmaceutical industry, generating 37% of the total number of granted patents worldwide. However, there is still a large margin for growth and innovation within the industry. Revisions to the current IP system to ensure greater reliability for R&D, research and development, Investments is a prominent topic of debate in the US as well. 23. Blood products and other human-derived biologics such as breast milk have highly regulated or very hard-to-access markets. Therefore, customers generally face a supply shortage for these products. Institutions housing these biologics, designated as banks, often cannot distribute their product to customers effectively. 24. Conversely, banks for reproductive cells are much more widespread and available due to the ease with which spermatozoa and egg cells can be used for fertility treatment. 25. Large-scale production. Biopharmaceuticals may be produced from microbial cells, example, recombinant E. coli or yeast cultures, mammalian cell lines, C-cell culture, and plant cell cultures, C. plant tissue culture, and moss plants in bioreactors of various configurations, including photobioreactors. 26. Important issues of concern are cost of production, low volume, high purity products are desirable, and microbial contamination, by bacteria, viruses, mycoplasma. Alternative platforms of production which are being tested include whole plants, plant-made pharmaceuticals. Transgenics. Main article, Farming, Genetics. A potentially controversial method of producing biopharmaceuticals involves transgenic organisms, particularly plants and animals that have been genetically modified to produce drugs. This production is a significant risk for its investor due to production failure or scrutiny from regulatory bodies based on perceived risks and ethical issues. Biopharmaceutical crops also represent a risk of cross-contamination with non-engineered crops, or crops engineered for non-medical purposes. One potential approach to this technology is the creation of a transgenic mammal that can produce the biopharmaceutical in its milk, blood, or urine. Once an animal is produced, typically using the pronuclear microinjection method, it becomes efficacious to use cloning technology to create additional offspring that carry the favorable modified genome. 27. The first such drug manufactured from the milk of a genetically modified goat was atryn, but marketing permission was blocked by the European Medicines Agency in February 2006. 28. This decision was reversed in June 2006 and approval was given August 2006. 29. Regulation. European Union. In the European Union, a biological medicinal product, 30, is one of the active substances produced from or extracted from a biological, living, system, and requires, in addition to physicochemical testing, biological testing for full characterization. The characterization of a biological medicinal product is a combination of testing the active substance and the final medicinal product together with the production process and its control. For example, production process, it can be derived from biotechnology or from other technologies. It may be prepared using more conventional techniques as is the case for blood or plasma-derived products and a number of vaccines. Active substance, consisting of entire microorganisms, mammalian cells, nucleic acids, proteinaceous, or polysaccharide components originating from a microbial, animal, human, or plant source. Mode of action, therapeutic and immunological medicinal products, gene transfer materials, or cell therapy materials. United States. In the United States, biologics are licensed through the Biologics License Application, BLA, then submitted to and regulated by the FDA's Center for Biologics Evaluation and Research, CBER, whereas drugs are regulated by the Center for Drug Evaluation and Research. Approval may require several years of clinical trials, including trials with human volunteers. Even after the drug is released, it will still be monitored for performance and safety risks. The manufacture process must satisfy the FDA's good manufacturing practices, which are typically manufactured in a cleanroom environment with strict limits on the amount of airborne particles and other microbial contaminants that may alter the efficacy of the drug. 31. Canada. In Canada, biologics and radiopharmaceuticals are reviewed through the Biologics and Genetic Therapies Directorate within Health Canada. 32. See also: therapeutic protein, antibody-drug conjugate, genetic engineering, host cell protein, list of pharmaceutical companies, list of recombinant proteins, nanomedicine, radiation, medicine, redirects here. Not to be confused with radiation, pain, or radiology. Radiation therapy. Radiation therapy of the pelvis, using a Varian Clinac IX linear accelerator. Lasers and a mold under the legs are used to determine exact position. ICD-10 PCSD. ICD-9 CM 92.2 to 92.3. MESH D011878. OPS 301 code 8 to 52. Medline plus 001918. Edit on Wikidata. Radiation therapy or radiotherapy, often abbreviated RT, RTX, or XRT, is a treatment using ionizing radiation, generally provided as part of cancer therapy to either kill or control the growth of malignant cells. It is normally delivered by a linear particle accelerator. Radiation therapy may be curative in a number of types of cancer if they are localized to one area of the body and have not spread to other parts. It may also be used as part of adjuvant therapy to prevent tumor recurrence after surgery to remove a primary malignant tumor, for example, early stages of breast cancer. Radiation therapy is synergistic with chemotherapy and has been used before, during, and after chemotherapy in susceptible cancers. The subspecialty of oncology concerned with radiotherapy is called radiation oncology. A physician who practices in this subspecialty is a radiation oncologist. Radiation therapy is commonly applied to the cancerous tumor because of its ability to control cell growth. Ionizing radiation works by damaging the DNA of cancerous tissue, leading to cellular death. To spare normal tissues, such as skin or organs which radiation must pass through to treat the tumor, shaped radiation beams are aimed from several angles of exposure to intersect at the tumor, providing a much larger absorbed dose there than in the surrounding healthy tissue. Besides the tumor itself, the radiation fields may also include the draining lymph nodes if they are clinically or radiologically involved with the tumor, or if there is thought to be a risk of subclinical malignant spread. It is necessary to include a margin of normal tissue around the tumor to allow for uncertainties in daily setup and internal tumor motion. These uncertainties can be caused by internal movement, for example, respiration and bladder filling, and movement of external skin marks relative to the tumor position. Radiation oncology is the medical specialty concerned with prescribing radiation, and is distinct from radiology, the use of radiation in medical imaging and diagnosis. Radiation may be prescribed by a radiation oncologist with intent to cure or for adjuvant therapy. It may also be used as palliative treatment, where cure is not possible and the aim is for local disease control or symptomatic relief, or as therapeutic treatment, where the therapy has survival benefit and can be curative. 1. It is also common to combine radiation therapy with surgery, chemotherapy, hormone therapy, immunotherapy, or some mixture of the four. Most common cancer types can be treated with radiation therapy in some way. The precise treatment intent, curative, adjuvant, neoadjuvant therapeutic, or palliative, will depend on the tumor type, location, and stage, as well as the general health of the patient. Total body irradiation, TBI, is a radiation therapy technique used to prepare the body to receive a bone marrow transplant. Brachytherapy, in which a radioactive source is placed inside or next to the area requiring treatment, is another form of radiation therapy that minimizes exposure to healthy tissue during procedures to treat cancers of the breast, prostate, and other organs. Radiation therapy has several applications in non-malignant conditions, such as the treatment of trigeminal neuralgia, acoustic neuromas, severe thyroid eye disease, pterygium, pigmented villonodular synovitis, and prevention of keloid scar growth, vascular restenosis, and heterotopic ossification. 1, 2, 3, 4. The use of radiation therapy in non-malignant conditions is limited partly by worries about the risk of radiation-induced cancers. Medical uses. It is estimated that half of the U.S. 1.2 million invasive cancer cases diagnosed in 2022 received radiation therapy in their treatment program. 5. Different cancers respond to radiation therapy in different ways. 6, 7, 8. The response of a cancer to radiation is described by its radiosensitivity. Highly radiosensitive cancer cells are rapidly killed by modest doses of radiation. These include leukemias, most lymphomas, and germ cell tumors. The majority of epithelial cancers are only moderately radiosensitive and require a significantly higher dose of radiation, 60 to 70 grays, to achieve a radical cure. Some types of cancer are notably radioresistant, that is, much higher doses are required to produce a radical cure than may be safe in clinical practice. Renal cell cancer and melanoma are generally considered to be radioresistant, but radiation therapy is still a palliative option for many patients with metastatic melanoma. Combining radiation therapy with immunotherapy is an active area of investigation and has shown some promise for melanoma and other cancers. 9. It is important to distinguish the radiosensitivity of a particular tumor, which to some extent is a laboratory measure, from the radiation curability of a cancer in actual clinical practice. For example, leukemias are not generally curable with radiation therapy, because they are disseminated through the body. Lymphoma may be radically curable if it is localized to one area of the body. Similarly, many of the common, moderately radioresponsive tumors are routinely treated with curative doses of radiation therapy if they are at an early stage. For example, non-melanoma skin cancer, head and neck cancer, breast cancer, non-small cell lung cancer, cervical cancer, anal cancer, and prostate cancer. With the exception of oligometastatic disease, metastatic cancers are incurable with radiation therapy because it is not possible to treat the whole body. Modern radiation therapy relies on a CT scan to identify the tumor and surrounding normal structures and to perform dose calculations for the creation of a complex radiation treatment plan. The patient receives small skin marks to guide the placement of treatment fields. 10. Patient positioning is crucial at this stage as the patient will have to be placed in an identical position during each treatment. Many patient positioning devices have been developed for this purpose, including masks and cushions which can be molded to the patient. Image-guided radiation therapy is a method that uses imaging to correct for positional errors of each treatment session. The response of a tumor to radiation therapy is also related to its size. Due to complex radiobiology, very large tumors respond less well to radiation than smaller tumors or microscopic disease. Various strategies are used to overcome this effect. The most common technique is surgical resection prior to radiation therapy. This is most commonly seen in the treatment of breast cancer with wide local excision or mastectomy followed by adjuvant radiation therapy. Another method is to shrink the tumor with neoadjuvant chemotherapy prior to radical radiation therapy. A third technique is to enhance the radiosensitivity of the cancer by giving certain drugs during a course of radiation therapy. Examples of radiosensitizing drugs include cisplatin, nimorazole, and cetuximab. 11. The impact of radiotherapy varies between different types of cancer and different groups. 12. For example, for breast cancer after breast-conserving surgery, radiotherapy has been found to have the rate at which the disease recurs. 13. In pancreatic cancer, radiotherapy has increased survival times for inoperable tumors. 14. Side effects. Radiation therapy, RT, is in itself painless. Many low-dose palliative treatments, for example, radiation therapy to bony metastases, cause minimal or no side effects, although short-term pain flare-up can be experienced in the days following treatment due to edema compressing nerves in the treated area. Higher doses can cause varying side effects during treatment, acute side effects, in the months or years following treatment, long-term side effects, or after retreatment, cumulative side effects. The nature, severity, and longevity of side effects depends on the organs that receive the radiation, the treatment itself, type of radiation, dose, fractionation, concurrent chemotherapy, and the patient. Serious radiation complications may occur in 5% of RT cases. Acute, near immediate, or subacute, 2 to 3 months post-root, radiation side effects may develop after 50 grays RT dosing. Late or delayed radiation injury, 6 months to decades, may develop after 65 GY. 5. Most side effects are predictable and expected. Side effects from radiation are usually limited to the area of the patient's body that is under treatment. Side effects are dose-dependent. For example, higher doses of head and neck radiation can be associated with cardiovascular complications, thyroid dysfunction, and pituitary axis dysfunction. 15. Modern radiation therapy aims to reduce side effects to a minimum and to help the patient understand and deal with side effects that are unavoidable. The main side effects reported are fatigue and skin irritation, like a mild to moderate sunburn. The fatigue often sets in during the middle of a course of treatment and can last for weeks after treatment ends. The irritated skin will heal, but may not be as elastic as it was before. 16. Acute side effects. Nausea and vomiting. This is not a general side effect of radiation therapy, and mechanistically is associated only with treatment of the stomach or abdomen, which commonly react a few hours after treatment, or with radiation therapy to certain nausea-producing structures in the head during treatment of certain head and neck tumors, most commonly the vestibules of the inner ears. 17. As with any distressing treatment, some patients vomit immediately during radiotherapy, or even in anticipation of it, but this is Considered a psychological response. Nausea for any reason can be treated with antiemetics. 18. Damage to the epithelial surfaces. Epithelial surfaces may sustain damage from radiation therapy. 19. Depending on the area being treated, this may include the skin, oral mucosa, pharyngeal, bowel mucosa, and ureter. The rates of onset of damage and recovery from it depend upon the turnover rate of epithelial cells. Typically, the skin starts to become pink and sore several weeks into treatment. The reaction may become more severe during the treatment and for up to about 1 week following the end of radiation therapy, and the skin may break down. Although this moist desquamation is uncomfortable, recovery is usually quick. Skin reactions tend to be worse in areas where there are natural folds in the skin, such as underneath the female breast, behind the ear, and in the groin, mouth, throat, and stomach sores. If the head and neck area is treated, temporary soreness and ulceration commonly occur in the mouth and throat. 20. If severe, this can affect swallowing, and the patient may need painkillers and nutritional support/food supplements. The esophagus can also become sore if it is treated directly, or if, as commonly occurs, it receives a dose of collateral radiation during treatment of lung cancer. When treating liver malignancies and metastases, it is possible for collateral radiation to cause gastric, stomach, or duodenal ulcers. 21. 22. This collateral radiation is commonly caused by non-targeted delivery, reflux, of the radioactive agents being infused. 23. Methods, techniques, and devices are available to lower the occurrence of this type of adverse side effect. 24. Intestinal discomfort. The lower bowel may be treated directly with radiation, treatment of rectal or anal cancer, or be exposed by radiation therapy to other pelvic structures, prostate, bladder, female genital tract. Typical symptoms are soreness, diarrhea, and nausea. Nutritional interventions may be able to help with diarrhea associated with radiotherapy. 25. Studies in people having pelvic radiotherapy as part of anti-cancer treatment for a primary pelvic cancer found that changes in dietary fat, fiber, and lactose during radiotherapy reduced diarrhea at the end of treatment. 25. Swelling. As part of the general inflammation that occurs, swelling of soft tissues may cause problems during radiation therapy. This is a concern during treatment of brain tumors and brain metastases, especially where there is pre-existing raised intracranial pressure or where the tumor is causing near-total obstruction of a lumen, example, trachea or main bronchus. Surgical intervention may be considered prior to treatment with radiation. If surgery is deemed unnecessary or inappropriate, the patient may receive steroids during radiation therapy to reduce swelling. Infertility. The gonads, ovaries and testicles, are very sensitive to radiation. They may be unable to produce gametes following direct exposure to most normal treatment doses of radiation. Treatment planning for all body sites is designed to minimize, if not completely exclude dose to the gonads if they are not the primary area of treatment. Late side effects. Late side effects occur months to years after treatment and are generally limited to the area that has been treated. They are often due to damage of blood vessels and connective tissue cells. Many late effects are reduced by fractionating treatment into smaller parts. Fibrosis. Tissues which have been irradiated tend to become less elastic over time due to a diffuse scarring process. Epilation. Epilation, hair loss, may occur on any hair-bearing skin with doses above 1 gray. It only occurs within the radiation field/S. Hair loss may be permanent with a single dose of 10 grays, but if the dose is fractionated, permanent hair loss may not occur until dose exceeds 45 grays. Dryness. The salivary glands and tear glands have a radiation tolerance of about 30 grays and 2 grays fractions, a dose which is exceeded by most radical head and neck cancer treatments. Dry mouth, xerostomia, and dry eyes, xerophthalmia, can become irritating long-term problems and severely reduce the patient's quality of life. Similarly, sweat glands in treated skin, such as the armpit, tend to stop working, and the naturally moist vaginal mucosa is often dry following pelvic irradiation. Chronic sinus drainage. Radiation therapy treatments to the head and neck regions for soft tissue, palate, or bone cancer can cause chronic sinus tract draining and fistulae from the bone. 5. Lymphedema. Lymphedema, a condition of localized fluid retention and tissue swelling, can result from damage to the lymphatic system sustained during radiation therapy. It is the most commonly reported complication in breast radiation therapy patients who receive adjuvant axillary radiotherapy following surgery to clear the axillary lymph nodes. 26. Cancer. Radiation is a potential cause of cancer, and secondary malignancies are seen in some patients. Cancer survivors are already more likely than the general population to develop malignancies due to a number of factors including lifestyle choices, genetics, and previous radiation treatment. It is difficult to directly quantify the rates of these secondary cancers from any single cause. Studies have found radiation therapy as the cause of secondary malignancies for only a small minority of patients, 27, 28. New techniques such as proton beam therapy and carbon ion radiotherapy which aim to reduce dose to healthy tissues will lower these risks, 29, 30. It starts to occur 4 to 6 years following treatment, although some hematological malignancies may develop within 3 years. In the vast majority of cases, this risk is greatly outweighed by the reduction in risk conferred by treating the primary cancer even in pediatric malignancies which carry a higher burden of secondary malignancies. 31. Cardiovascular disease. Radiation can increase the risk of heart disease and death as observed in previous breast cancer RT regimens. 32. Therapeutic radiation increases the risk of a subsequent cardiovascular event, i.e., heart attack or stroke, by 1.5 to 4 times a person's normal rate. Aggravating factors included. 33. The increase is dose-dependent, related to the RT's dose strength, volume and location. Use of concomitant chemotherapy, e.g. anthracyclines, is an aggravating risk factor. 34. The occurrence rate of RT-induced cardiovascular disease is estimated between 10 and 30%. 34. Cardiovascular late side effects have been termed radiation-induced heart disease, RIHD, and radiation-induced cardiovascular disease, RIVD. 35. 36. Symptoms are dose-dependent and include cardiomyopathy, myocardial fibrosis, valvular heart disease, coronary artery disease, heart arrhythmia and peripheral artery disease. Radiation-induced fibrosis, vascular cell damage and oxidative stress can lead to these and other late side effect symptoms. 35. Most radiation-induced cardiovascular diseases occur 10 or more years post-treatment, making causality determinations more difficult. 33. Cognitive decline. In cases of radiation applied to the head, radiation therapy may cause cognitive decline. Cognitive decline was especially apparent in young children, between the ages of 5 and 11. Studies found, for example, that the IQ of 5-year-old children declined each year after treatment by several IQ points. 37. Radiation enteropathy. Histopathology of radiation cystitis, including atypical stromal cells, radiation fibroblasts. The gastrointestinal tract can be damaged following abdominal and pelvic radiotherapy. 38. Atrophy, fibrosis and vascular changes produce malabsorption, diarrhea, steatorrhea and bleeding with bile acid diarrhea and vitamin B12 malabsorption commonly found due to ileal involvement. Pelvic radiation disease includes radiation proctitis, producing bleeding, diarrhea and urgency. 39, and can also cause radiation cystitis when the bladder is affected. Radiation-induced polyneuropathy. Radiation treatments may damage nerves near the target area or within the delivery path as nerve tissue is also radiosensitive. 40. Nerve damage from ionizing radiation occurs in phases, the initial phase from microvascular injury, capillary damage and nerve demyelination. 41. Subsequent damage occurs from vascular constriction and nerve compression due to uncontrolled fibrous tissue growth caused by radiation. 41. Radiation-induced polyneuropathy, ICD-10 CM code G62.82, occurs in approximately 1 to 5% of those receiving radiation therapy. 41, 40. Depending upon the irradiated zone, late-effect neuropathy may occur in either the central nervous system, CNS, or the peripheral nervous system, PNS. In the CNS, for example, cranial nerve injury typically presents as a visual acuity loss 1 to 14 years post-treatment. 41. In the PNS, injury to the plexus nerves presents as radiation-induced brachial plexopathy or radiation-induced lumbosacral plexopathy appearing up to 3 decades post-treatment. 41. Radiation necrosis. Radiation necrosis is the death of healthy tissue near the irradiated site. It is a type of coagulative necrosis that occurs because the radiation directly or indirectly damages blood vessels in the area, which reduces the blood supply to the remaining healthy tissue, causing it to die by ischemia, similar to what happens in an ischemic stroke. 42. Because it is an indirect effect of the treatment, it occurs months to decades after radiation exposure. 42. Radiation necrosis most commonly presents as osteoradionecrosis, vaginal radionecrosis, soft tissue radionecrosis, or laryngeal radionecrosis. 5. Cumulative side effects. Cumulative effects from this process should not be confused with long-term effects. When short-term effects have disappeared and long-term effects are subclinical, reirradiation can still be problematic. 43. These doses are calculated by the radiation oncologist and many factors are taken into account before the subsequent radiation takes place. Effects on reproduction. During the first 2 weeks after fertilization, radiation therapy is lethal but not teratogenic. 44. High doses of radiation during pregnancy induce anomalies, impaired growth and intellectual disability, and there may be an increased risk of childhood leukemia and other tumors in the offspring. 44. In males previously having undergone radiotherapy, there appears to be no increase in genetic defects or congenital malformations in their children conceived after therapy. 44. However, the use of assisted reproductive technologies and micromanipulation techniques might increase this risk. 44. Effects on pituitary system. Hypopituitarism commonly develops after radiation therapy for cellular and paracellular neoplasms, extracellular brain tumors, head and neck tumors, and following whole-body irradiation for systemic malignancies. 45. 40 to 50% of children treated for childhood cancer develop some endocrine side effect. 46. Radiation-induced hypopituitarism mainly affects growth hormone and gonadal hormones. 45. In contrast, adrenocorticotropic hormone, ACTH, and thyroid-stimulating hormone, TSH, deficiencies are the least common among people with radiation-induced hypopituitarism. 45. Changes in prolactin secretion is usually mild, and vasopressin deficiency appears to be very rare as a consequence of radiation. 45. Effects on subsequent surgery. Delayed tissue injury with impaired wound healing capability often develops after 65 gray radiation. A diffuse injury pattern due to the external beam radiotherapy's holographic isodosing occurs. While the targeted tumor receives the majority of radiation, healthy tissue at incremental distances from the center of the tumor are also irradiated in a diffuse pattern due to beam divergence. These wounds demonstrate progressive, proliferative endarteritis, inflamed arterial linings that disrupt the tissue's blood supply. Such tissue ends up chronically hypoxic, fibrotic, and without an adequate nutrient and oxygen supply. Surgery of previously irradiated tissue has a very high failure rate, e.g. women who have received radiation for breast cancer develop late-effect chest wall tissue fibrosis and hypovascularity, making successful reconstruction and healing difficult, if not impossible. 5. Radiation therapy accidents. There are rigorous procedures in place to minimize the risk of accidental overexposure of radiation therapy to patients. However, mistakes do occasionally occur. For example, the radiation therapy machine Therac 25 was responsible for at least 6 accidents between 1985 and 1987, where patients were given up to 100 times the intended dose. 2 people were killed directly by the radiation overdoses. From 2005 to 2010, a hospital in Missouri overexposed 76 patients, most with brain cancer, during a 5-year period because new radiation equipment had been set up incorrectly. 47. Although medical errors are exceptionally rare, radiation oncologists, medical physicists and other members of the radiation therapy treatment team are working to eliminate them. In 2010, the American Society for Radiation Oncology, ASTRO, launched a safety initiative called Target Safely that, among other things, aimed to record errors nationwide so that doctors can learn from each and every mistake and prevent them from recurring. ASTRO also publishes a list of questions for patients to ask their doctors about radiation safety to ensure every treatment is as safe as possible. 48. Use in non-cancerous diseases. The beam's eye view of the radiotherapy portal on the hand surface with the lead shield cutout placed in the machine's gantry. Radiation therapy is used to treat early-stage Dupuytren's disease and Lederho's disease. When Dupuytren's disease is at the nodules and cords stage or fingers are at a minimal deformation stage of less than 10 degrees, then radiation therapy is used to prevent further progress of the disease. Radiation therapy is also used post-surgery in some cases to prevent the disease continuing to progress. Low doses of radiation are used, typically 3 gray of radiation for 5 days, with a break of 3 months followed by another phase of 3 gray of radiation for 5 days. 49. Technique. Mechanism of action. Radiation therapy works by damaging the DNA of cancerous cells and can cause them to undergo mitotic catastrophe. 50. This DNA damage is caused by one of two types of energy, photon or charged particle. This damage is either direct or indirect ionization of the atoms which make up the DNA chain. Indirect ionization happens as a result of the ionization of water, forming free radicals, notably hydroxyl radicals, which then damage the DNA. In photon therapy, most of the radiation effect is through free radicals. Cells have mechanisms for repairing single-strand DNA damage and double-stranded DNA damage. However, double-stranded DNA breaks are much more difficult to repair, and can lead to dramatic chromosomal abnormalities and genetic deletions. Targeting double-stranded breaks increases the probability that cells will undergo cell death. Cancer cells are generally less differentiated and more stem cell-like. They reproduce more than most healthy differentiated cells, and have a diminished ability to repair sublethal damage. Single-strand DNA damage is then passed on through cell division. Damage to the cancer cell's DNA accumulates, causing them to die or reproduce more slowly. One of the major limitations of photon radiation therapy is that the cells of solid tumors become deficient in oxygen. Solid tumors can outgrow their blood supply, causing a low oxygen state known as hypoxia. Oxygen is a potent radiosensitizer, increasing the effectiveness of a given dose of radiation by forming DNA-damaging free radicals. Tumor cells in a hypoxic environment may be as much as 2 to 3 times more resistant to radiation damage than those in a normal oxygen environment. 51. Much research has been devoted to overcoming hypoxia, including the use of high-pressure oxygen tanks, hyperthermia therapy, heat therapy which dilates blood vessels to the tumor site, blood substitutes that carry increased oxygen, hypoxic cell radiosensitizer drugs such as misonidazole and metronidazole, and hypoxic cytotoxins, tissue poisons, such as tirapazamine. Newer research approaches are currently being studied, including preclinical and clinical investigations into the use of an oxygen diffusion-enhancing compound such as trans-sodium crocetinate as a radiosensitizer. 52. Charged particles such as protons and boron, carbon, and neon ions can cause direct damage to cancer cell DNA through high-let, linear energy transfer, and have an anti-tumor effect independent of tumor oxygen supply because these particles act mostly via direct energy transfer, usually causing double-stranded DNA breaks. Due to their relatively large mass, protons and other charged particles have little lateral side scatter in the tissue. The beam does not broaden much, stays focused on the tumor shape, and delivers small dose side effects to surrounding tissue. They also more precisely target the tumor using the Bragg peak effect. See proton therapy for a good example of the different effects of intensity-modulated radiation therapy, IMRT, versus charged particle therapy. This procedure reduces damage to healthy tissue between the charged particle radiation source and the tumor and sets a finite range for tissue damage after the tumor has been reached. In contrast, IMRT's use of uncharged particles causes its energy to damage healthy cells when it exits the body. This exiting damage is not therapeutic, can increase treatment side effects, and increases the probability of secondary cancer induction. 53. This difference is very important in cases where the close proximity of other organs makes any stray ionization very damaging, example, head and neck cancers. This X-ray exposure is especially bad for children, due to their growing bodies, and while depending on a multitude of factors, they are around 10 times more sensitive to developing secondary malignancies after radiotherapy as compared to adults. 54. Dose. The amount of radiation used in photon radiation therapy is measured in grays, GY, and varies depending on the type and stage of cancer being treated. For curative cases, the typical dose for a solid epithelial tumor ranges from 60 to 80 grays, while lymphomas are treated with 20 to 40 grays. Preventive, adjuvant, doses are typically around 45 to 60 grays in 1.8 to 2 grays fractions, for breast, head, and neck cancers. Many other factors are considered by radiation oncologists when selecting a dose, including whether the patient is receiving chemotherapy, patient comorbidities, whether radiation therapy is being administered before or after surgery, and the degree of success of surgery. Delivery parameters of a prescribed dose are determined during treatment planning, part of dosimetry. Treatment planning is generally performed on dedicated computers using specialized treatment planning software. Depending on the radiation delivery method, several angles or sources may be used to sum to the total necessary dose. The planner will try to design a plan that delivers a uniform prescription dose to the tumor and minimizes dose to surrounding healthy tissues. In radiation therapy, three-dimensional dose distributions may be evaluated using the dosimetry technique known as gel dosimetry. 55. Fractionation. This section only applies to photon radiotherapy, although other types of radiation therapy may be fractionated. Main article, Dose fractionation. The total dose is fractionated, spread out over time, for several important reasons. Fractionation allows normal cells time to recover, while tumor cells are generally less efficient in repair between fractions. Fractionation also allows tumor cells that were in a relatively radioresistant phase of the cell cycle during one treatment to cycle into a sensitive phase of the cycle before the next fraction is given. Similarly, tumor cells that were chronically or acutely hypoxic, and therefore more radioresistant, may reoxygenate between fractions, improving the tumor cell kill. 56. Fractionation regimens are individualized between different radiation therapy centers and even between individual doctors. In North America, Australia, and Europe, the typical fractionation schedule for adults is 1.8 to 2 grays per day, 5 days a week. In some cancer types, prolongation of the fraction schedule over too long can allow for the tumor to begin repopulating, and for these tumor types, including head and neck and cervical squamous cell cancers, radiation treatment is preferably completed within a certain amount of time. For children, a typical fraction size may be 1.5 to 1.8 grays per day, as smaller fraction sizes are associated with reduced incidence and severity of late-onset side effects in normal tissues. In some cases, 2 fractions per day are used near the end of a course of treatment. This schedule, known as a concomitant boost regimen or hyperfractionation, is used on tumors that regenerate more quickly when they are smaller. In particular, tumors in the head and neck demonstrate this behavior. Patients receiving palliative radiation to treat uncomplicated painful bone metastasis should not receive more than a single fraction of radiation. 57. A single treatment gives comparable pain relief and morbidity outcomes to multiple fraction treatments, and for patients with limited life expectancy, a single treatment is best to improve patient comfort. 57. Schedules for fractionation. One fractionation schedule that is increasingly being used and continues to be studied is hypofractionation. This is a radiation treatment in which the total dose of radiation is divided into large doses. Typical doses vary significantly by cancer type, from 2.2 grays per fraction to 20 grays per fraction, the latter being typical of stereotactic treatments, stereotactic ablative body radiotherapy, or SABR, also known as SBRT, or stereotactic body radiotherapy, for subcranial lesions, or SRS, stereotactic radiosurgery, for intracranial lesions. The rationale of hypofractionation is to reduce the probability of local recurrence by denying clonogenic cells the time they require to reproduce and also to exploit the radiosensitivity of some tumors. 58. In particular, stereotactic treatments are intended to destroy clonogenic cells by a process of ablation, i.e. the delivery of a dose intended to destroy clonogenic cells directly, rather than to interrupt the process of clonogenic cell division repeatedly, apoptosis, as in routine radiotherapy. Estimation of dose based on target sensitivity. Different cancer types have different radiation sensitivity. While predicting the sensitivity based on genomic or proteomic analyses of biopsy samples has proven challenging, 59, 60, the predictions of radiation effect on individual patients from genomic signatures of intrinsic cellular radiosensitivity have been shown to associate with clinical outcome, 61. An alternative approach to genomics and proteomics was offered by the discovery that radiation protection in microbes is offered by non-enzymatic complexes of manganese and small organic metabolites. 62. The content and variation of manganese, measurable by electron paramagnetic resonance, were found to be good predictors of radiosensitivity, and this finding extends also to human cells. 63. An association was confirmed between total cellular manganese contents and their variation, and clinically inferred radioresponsiveness in different tumor cells, a finding that may be useful for more precise radiodosages and improved treatment of cancer patients. 64. Types. Historically, the 3 main divisions of radiation therapy are external beam radiation therapy, EBRT or XRT, or teletherapy, brachytherapy or sealed source radiation therapy, and systemic radioisotope therapy or unsealed source radiotherapy. The differences relate to the position of the radiation source. External is outside the body. Brachytherapy uses sealed radioactive sources placed precisely in the area under treatment, and systemic radioisotopes are given by infusion or oral ingestion. Brachytherapy can use temporary or permanent placement of radioactive sources. The temporary sources are usually placed by a technique called afterloading. In afterloading, a hollow tube or applicator is placed surgically in the organ to be treated, and the sources are loaded into the applicator after the applicator is implanted. This minimizes radiation exposure to healthcare personnel. Particle therapy is a special case of external beam radiation therapy where the particles are protons or heavier ions. A review of radiation therapy randomized clinical trials from 2018 to 2021 found many practice-changing data and new concepts that emerge from RCTs, identifying techniques that improve the therapeutic ratio, techniques that lead to more tailored treatments, stressing the importance of patient satisfaction, and identifying areas that require further study. 65-66. External beam radiation therapy. Main article, External beam radiation therapy. The following three sections refer to treatment using X-rays. Conventional external beam radiation therapy. A teletherapy radiation capsule composed of the following: an international standard source holder, usually lead, a retaining ring, and a teletherapy source composed of 2 nested stainless steel canisters welded to 2 stainless steel lids surrounding a protective internal shield, usually uranium metal or a tungsten alloy, and a cylinder of radioactive source material, often but not always cobalt-60. The diameter of the source is 30 mm. Historically, conventional external beam radiation therapy, 2DXRT, was delivered via two-dimensional beams using kilovoltage therapy X-ray units, medical linear accelerators that generate high-energy X-rays, or with machines that were similar to a linear accelerator in appearance, but used a sealed radioactive source like the one shown above. 67-68. 2DXRT mainly consists of a single beam of radiation delivered to the patient from several directions, often front or back, and both sides. Conventional refers to the way the treatment is planned or simulated on a specially calibrated diagnostic X-ray machine known as a simulator because it recreates the linear accelerator actions, or sometimes by eye, and to the usually well-established arrangements of the radiation beams to achieve a desired plan. The aim of simulation is to accurately target or localize the volume which is to be treated. This technique is well established and is generally quick and reliable. The worry is that some high-dose treatments may be limited by the radiation toxicity capacity of healthy tissues which lie close to the target tumor volume. An example of this problem is seen in radiation of the prostate gland, where the sensitivity of the adjacent rectum limited the dose which could be safely prescribed using 2DXRT planning to such an extent that tumor control may not be easily achievable. Prior to the invention of the CT, physicians and physicists had limited knowledge about the true radiation dosage delivered to both cancerous and healthy tissue. For this reason, three-dimensional conformal radiation therapy has become the standard treatment for almost all tumor sites. More recently, other forms of imaging are used, including MRI, PET, SPECT, and ultrasound. 69. Stereotactic radiation. Main article, Radiosurgery. Stereotactic radiation is a specialized type of external beam radiation therapy. It uses focused radiation beams targeting a well-defined tumor using extremely detailed imaging scans. Radiation oncologists perform stereotactic treatments, often with the help of a neurosurgeon for tumors in the brain or spine. There are two types of stereotactic radiation. Stereotactic radiosurgery, SRS, is when doctors use a single or several stereotactic radiation treatments of the brain or spine. Stereotactic body radiation therapy, SBRT, refers to one or several stereotactic radiation treatments with the body, such as the lungs. 70. Some doctors say an advantage to stereotactic treatments is that they deliver the right amount of radiation to the cancer in a shorter amount of time than traditional treatments, which can often take 6 to 11 weeks. Plus, treatments are given with extreme accuracy, which should limit the effect of the radiation on healthy tissues. One problem with stereotactic treatments is that they are only suitable for certain small tumors. Stereotactic treatments can be confusing because many hospitals call the treatments by the name of the manufacturer rather than calling it SRS or SBRT. Brand names for these treatments include XS, CyberKnife, Gamma Knife, Novalis, Primatom, Synergy, X-Knife, Tomotherapy, Trilogy and TrueBeam. 71. This list changes as equipment manufacturers continue to develop new, specialized technologies to treat cancers. Virtual simulation, and three-dimensional conformal radiation therapy. The planning of radiation therapy treatment has been revolutionized by the ability to delineate tumors and adjacent normal structures in 3 dimensions using specialized CT and/or MRI scanners and planning software. 72. Virtual simulation, the most basic form of planning, allows more accurate placement of radiation beams than is possible using conventional X-rays, where soft tissue structures are often difficult to assess and normal tissues difficult to protect. An enhancement of virtual simulation is three-dimensional conformal radiation therapy, 3D-CRT, in which the profile of each radiation beam is shaped to fit the profile of the target from a beam's eye view, BEV, using a multi-leaf collimator, MLC, and a variable number of beams. When the treatment volume conforms to the shape of the tumor, the relative toxicity of radiation to the surrounding normal tissues is reduced, allowing a higher dose of radiation to be delivered to the tumor than conventional techniques would allow. 10. Intensity modulated radiation therapy, IMRT. Varian TrueBeam linear accelerator, used for delivering IMRT. Intensity modulated radiation therapy, IMRT, is an advanced type of high-precision radiation that is the next generation of 3D-CRT. 73. IMRT also improves the ability to conform the treatment volume to concave tumor shapes. 10. For example, when the tumor is wrapped around a vulnerable structure such as the spinal cord or a major organ or blood vessel. 74. Computer-controlled X-ray accelerators distribute precise radiation doses to malignant tumors or specific areas within the tumor. The pattern of radiation delivery is determined using highly tailored computing applications to perform optimization and treatment simulation, treatment planning. The radiation dose is consistent with the 3D shape of the tumor by controlling, or modulating, the radiation beam's intensity. The radiation dose intensity is elevated near the gross tumor volume while radiation among the neighboring normal tissues is decreased or avoided completely. This results in better tumor targeting, lessened side effects, and improved treatment outcomes than even 3D CRT. Temporally feathered radiation therapy, TFRT. Temporally feathered radiation therapy, TFRT, is a radiation technique introduced in 2018, 85, which aims to use the inherent nonlinearities in normal tissue repair to allow for sparing of these tissues without affecting the dose delivered to the tumor. The application of this technique, which has yet to be automated, has been described carefully to enhance the ability of departments to perform it, and in 2021 it was reported as feasible in a small clinical trial. 86, though its efficacy has yet to be formally studied. Automated planning. Automated treatment planning has become an integrated part of radiotherapy treatment planning. There are in general 2 approaches of automated planning. 1. Knowledge-based planning, where the treatment planning system has a library of high-quality plans, from which it can predict the target and dose volume histogram of the organ at risk. 87. 2. The other approach is commonly called protocol-based planning, where the treatment planning system tried to mimic an experienced treatment planner and through an iterative process evaluates the plan quality from on the basis of the protocol. 88, 89, 90, 91. Particle therapy. Main article, particle therapy. In particle therapy, proton therapy being one example, energetic ionizing particles, protons or carbon ions, are directed at the target tumor. 92. The dose increases while the particle penetrates the tissue, up to a maximum, the Bragg peak, that occurs near the end of the particle's range, and it then drops to almost 0. The advantage of this energy deposition profile is that less energy is deposited into the healthy tissue surrounding the target tissue. Auger therapy. Main article, auger therapy. Auger therapy, makes use of a very high dose, 93, of ionizing radiation in situ that provides molecular modifications at an atomic scale. It differs from conventional radiation therapy in several aspects. It neither relies upon radioactive nuclei to cause cellular radiation damage at a cellular dimension, nor engages multiple external pencil beams from different directions to zero in to deliver a dose to the targeted area with reduced dose outside the targeted tissue/organ locations. Instead, the in situ delivery of a very high dose at the molecular level using it aims for in situ molecular modifications involving molecular breakages and molecular rearrangements such as a change of stacking structures as well as cellular metabolic functions related to the said molecule structures. Motion compensation. In many types of external beam radiotherapy, motion can negatively impact the treatment delivery by moving target tissue out of, or other healthy tissue into, the intended beam path. Some form of patient immobilization is common, to prevent the large movements of the body during treatment, however this cannot prevent all motion, for example as a result of breathing. Several techniques have been developed to account for motion like this. 95, deep inspiration breath hold, DIBH, is commonly used for breast treatments where it is important to avoid irradiating the heart. In DIBH the patient holds their breath after breathing in to provide a stable position for the treatment beam to be turned on. This can be done automatically using an external monitoring system such as a spirometer or a camera and markers. 96. The same monitoring techniques, as well as 4D CT imaging, can also be for respiratory gated treatment, where the patient breathes freely and the beam is only engaged at certain points in the breathing cycle. 97. Other techniques include using 4D CT imaging to plan treatments with margins that account for motion, and active movement of the treatment couch, or beam, to follow motion. 98. Contact X-ray brachytherapy. Contact X-ray brachytherapy, also called CXB, electronic brachytherapy or the Papillon technique, is a type of radiation therapy using kilovoltage X-rays applied close to the tumor to treat rectal cancer. The process involves inserting the X-ray tube through the anus into the rectum and placing it against the cancerous tissue, then high doses of X-rays are emitted directly into the tumor at 2 weekly intervals. It is typically used for treating early rectal cancer in patients who may not be candidates for surgery. 99, 100, 101. A 2015 NICE review found the main side effect to be bleeding that occurred in about 38% of cases, and radiation-induced ulcer which occurred in 27% of cases. 99. Brachytherapy, sealed source radiotherapy. Main article, Brachytherapy. A Savi brachytherapy device. Brachytherapy is delivered by placing radiation sources inside or next to the area requiring treatment. Brachytherapy is commonly used as an effective treatment for cervical, 102, prostate, 103, breast, 104, and skin cancer, 105, and can also be used to treat tumors in many other body sites, 106. In brachytherapy, radiation sources are precisely placed directly at the site of the cancerous tumor. This means that the irradiation only affects a very localized area. Exposure to radiation of healthy tissues further away from the sources is reduced. These characteristics of brachytherapy provide advantages over external beam radiation therapy. The tumor can be treated with very high doses of localized radiation, whilst reducing the probability of unnecessary damage to surrounding healthy tissues. 106. 107. A course of brachytherapy can often be completed in less time than other radiation therapy techniques. This can help reduce the chance of surviving cancer cells dividing and growing in the intervals between each radiation therapy dose. 107. As one example of the localized nature of breast brachytherapy, the Savi device delivers the radiation dose through multiple catheters, each of which can be individually controlled. This approach decreases the exposure of healthy tissue and resulting side effects, compared both to external beam radiation therapy and older methods of breast brachytherapy. 108. Radionuclide therapy. Main article, Radionuclide therapy. Radionuclide therapy, also known as systemic radioisotope therapy, radiopharmaceutical therapy, or molecular radiotherapy, is a form of targeted therapy. Targeting can be due to the chemical properties of the isotope such as radioiodine, which is specifically absorbed by the thyroid gland 1,000-fold better than other bodily organs. Targeting can also be achieved by attaching the radioisotope to another molecule or antibody to guide it to the target tissue. The radioisotopes are delivered through infusion, into the bloodstream, or ingestion. Examples are the infusion of metiodobenzylguanidine, MIBG, to treat neuroblastoma, of oral iodine-131 to treat thyroid cancer or thyrotoxicosis, and of hormone-bound lutetium-177 and yttrium-90 to treat neuroendocrine tumors. Peptide receptor radionuclide therapy. Another example is the injection of radioactive yttrium-90 or holmium-166 microspheres into the hepatic artery to radioembolize liver tumors or liver metastases. These microspheres are used for the treatment approach known as selective internal radiation therapy. The microspheres are approximately 30 m in diameter, about 1/3 of a human hair, and are delivered directly into the artery supplying blood to the tumors. These treatments begin by guiding a catheter up through the femoral artery in the leg, navigating to the desired target site and administering treatment. The blood feeding the tumor will carry the microspheres directly to the tumor, enabling a more selective approach than traditional systemic chemotherapy. There are currently 3 different kinds of microspheres: SIR spheres, Therasphere, and Quirum spheres. A major use of systemic radioisotope therapy is in the treatment of bone metastasis from cancer. The radioisotopes travel selectively to areas of damaged bone and spare normal undamaged bone. Isotopes commonly used in the treatment of bone metastasis are radium-223, 109, strontium-89 and samarium-153 Sm, lexidronam, 110. In 2002, the United States Food and Drug Administration, FDA, approved ibrachimumab tioxetine, Zevalin, which is an anti-CD20 monoclonal antibody conjugated to yttrium-90, 111. In 2003, the FDA approved the tocilizumab/iodine, 131I, tocilizumab regimen, Bexar, which is a combination of an iodine-131 labeled and an unlabeled anti-CD20 monoclonal antibody, 112. These medications were the first agents of what is known as radioimmunotherapy, and they were approved for the treatment of refractory non-Hodgkin's lymphoma. Intraoperative radiotherapy. Main article: Intraoperative radiation therapy. Intraoperative radiation therapy, IORT, is applying therapeutic levels of radiation to a target area, such as a cancer tumor, while the area is exposed during surgery. 113. Rationale. The rationale for IORT is to deliver a high dose of radiation precisely to the targeted area with minimal exposure of surrounding tissues which are displaced or shielded during the IORT. Conventional radiation techniques such as external beam radiotherapy, EBRT, following surgical removal of the tumor have several drawbacks. The tumor bed where the highest dose should be applied is frequently missed due to the complex localization of the wound cavity even when modern radiotherapy planning is used. Additionally, the usual delay between the surgical removal of the tumor and EBRT may allow a repopulation of the tumor cells. These potentially harmful effects can be avoided by delivering the radiation more precisely to the targeted tissues, leading to immediate sterilization of residual tumor cells. Another aspect is that wound fluid has a stimulating effect on tumor cells. IORT was found to inhibit the stimulating effects of wound fluid. 114. History. X-ray treatment of tuberculosis in 1910. Before the 1920s, the hazards of radiation were not understood, and it was used to treat a wide range of diseases. Main article: History of radiation therapy. Medicine has used radiation therapy as a treatment for cancer for more than 100 years, with its earliest roots traced from the discovery of X-rays in 1895 by Wilhelm Röntgen. 115. Emil Grubb of Chicago was possibly the first American physician to use X-rays to treat cancer, beginning in 1896. 116. The field of radiation therapy began to grow in the early 1900s largely due to the groundbreaking work of Nobel Prize-winning scientist Marie Curie, 1867–1934, who discovered the radioactive elements polonium and radium in 1898. This began a new era in medical treatment and research. 115. Through the 1920s the hazards of radiation exposure were not understood, and little protection was used. Radium was believed to have wide curative powers and radiotherapy was applied to many diseases. Prior to World War II, the only practical sources of radiation for radiotherapy were radium, its emanation, radon gas, and the X-ray tube. External beam radiotherapy, teletherapy, began at the turn of the century with relatively low voltage, less than 150 kV, X-ray machines. It was found that while superficial tumors could be treated with low-voltage X-rays, more penetrating, higher energy beams were required to reach tumors inside the body, requiring higher voltages. Orthovoltage X-rays, which used tube voltages of 200 to 500 kV, began to be used during the 1920s. To reach the most deeply buried tumors without exposing intervening skin and tissue to dangerous radiation doses required rays with energies of 1 MV or above, called megavolt radiation. Producing megavolt X-rays required voltages on the X-ray tube of 3 to 5 million volts, which required huge expensive installations. Megavoltage X-ray units were first built in the late 1930s but because of cost were limited to a few institutions. One of the first, installed at St. Bartholomew's Hospital, London in 1937 and used until 1960, used a 30-foot-long X-ray tube and weighed 10 tons. Radium produced megavolt gamma rays, but was extremely rare and expensive due to its low occurrence in ores. In 1937 the entire world supply of radium for radiotherapy was 50 grams, valued at £800,000, or $50 million in 2005 dollars. The invention of the nuclear reactor in the Manhattan Project during World War II made possible the production of artificial radioisotopes for radiotherapy. Cobalt therapy, teletherapy machines using megavolt gamma rays emitted by cobalt-60, a radioisotope produced by irradiating ordinary cobalt metal in a reactor, revolutionized the field between the 1950s and the early 1980s. Cobalt machines were relatively cheap, robust and simple to use, although due to its 5.27-year half-life the cobalt had to be replaced about every 5 years. Medical linear particle accelerators, developed since the 1940s, began replacing X-ray and cobalt units in the 1980s and these older therapies are now declining. The first medical linear accelerator was used at the Hammersmith Hospital in London in 1953-68. Linear accelerators can produce higher energies, have more collimated beams, and do not produce radioactive waste with its attendant disposal problems like radioisotope therapies. With Godfrey Hounsfield's invention of computed tomography, CT, in 1971, three-dimensional planning became a possibility and created a shift from 2D to 3D radiation delivery. CT-based planning allows physicians to more accurately determine the dose distribution using axial tomographic images of the patient's anatomy. The advent of new imaging technologies, including magnetic resonance imaging, MRI, in the 1970s and positron emission tomography, PET, in the 1980s, has moved radiation therapy from 3D conformal to intensity-modulated radiation therapy, IMRT, and to image-guided radiation therapy tomotherapy. These advances allowed radiation oncologists to better see and target tumors, which have resulted in better treatment outcomes, more organ preservation and fewer side effects. 117. While access to radiotherapy is improving globally, more than half of patients in low and middle-income countries still do not have available access to the therapy as of 2017. 118. See also: beam spoiler, cancer and nausea, fast neutron therapy, neutron capture therapy of cancer, particle beam, radiation therapist, selective internal radiation therapy, treatment of cancer. Prehistoric medicine is any use of medicine from before the invention of writing and the documented history of medicine. Because the timing of the invention of writing per culture and region, the term prehistoric medicine encompasses a wide range of time periods and dates. 1. The study of prehistoric medicine relies heavily on artifacts and human remains, and on anthropology. Previously uncontacted peoples and certain indigenous peoples who live in a traditional way have been the subject of anthropological studies in order to gain insight into both contemporary and ancient practices. 2. Disease and mortality. Some diseases and ailments were more common in prehistory than they are today. There is evidence that many people suffered from osteoarthritis, probably caused by the lifting of heavy objects which would have been a daily and necessary task in their societies. Citation needed. For example, the transport of latte stones, a practice started during the Neolithic era, which involved hyperextension and torque of the lower back while dragging the stones, may have contributed to the development of microfractures in the spine and subsequent spondylolysis. Things such as cuts, bruises, and breakages of bone, without antiseptics, proper facilities, or knowledge of germs, would become very serious if infected, as they did not have sufficient ways to treat infection. 3. Unreliable source. There is also evidence of rickets, bone deformity and bone wastage, osteomalacia, 4, which is caused by a lack of vitamin D. The life expectancy in prehistoric times was low, 25 to 40 years. 5, with men living longer than women. Archaeological evidence of women and babies found together suggests that many women would have died in childbirth, perhaps accounting for the lower life expectancy in women than men. Another possible explanation for the shorter life spans of prehistoric humans may be malnutrition. Also, men as hunters may have sometimes received better food than the woman, who would consequently have been less resistant to disease. 6. Treatments for diseases. Plant materials. See also, History of Pharmacy. Herbs such as rosemary may have been used for medical purposes by prehistoric people, which 7, 8, 9. Plant materials, herbs and substances derived from natural sources, 10, were among the treatments for diseases in prehistoric cultures, which, since plant materials quickly rot under most conditions, historians are unlikely to fully understand which species were used in prehistoric medicine. A speculative view can be obtained by researching the climate of the respective society and then checking which species continue to grow in similar conditions today. 11. And through anthropological studies of existing indigenous peoples. 12. 13. Unlike the ancient civilizations which could source plant materials internationally, prehistoric societies would have been restricted to localized areas, though nomadic tribes may have had a greater variety of plant materials at their disposal than more stationary societies. The effects of different plant materials could have been found through trial and error. 14. Unreliable source. Gathering and dispensing of plant materials was in most cultures handled by women, who cared for the health of their family. 15. Plant materials were an important cure for diseases throughout history. 16. This fund of knowledge would have been passed down orally through the generations. The birch polypore fungus, commonly found in alpine environments, may have been used as a laxative by prehistoric people living in northern Europe, since it is known to bring on short bouts of diarrhea when ingested, and was found among the possessions of a mummified man. 17. The use of earth and clays. Earths and clays may have provided prehistoric peoples with some of their first medicines. This is related to geophagy, which is extremely widespread among animals in the wild as well as among domesticated animals. In particular, geophagy is widespread among contemporary non-human primates. 18. Also, early humans could have learned about the use of various healing clays by observing animal behavior. Such clay is used both internally and externally, such as for treating wounds, and after surgery. See below. Citation needed. Geophagy and the external use of clay are both still quite widespread among Aboriginal peoples around the world, as well as among pre-industrial populations. Surgery. Trepanning, sometimes trephining, was a basic surgical operation carried out in prehistoric societies across the world. 19. 20. Although evidence shows a concentration of the practice in Peru. 16. 19. 21. Several theories question the reasoning behind trepanning. It could have been used to cure certain conditions such as headaches and epilepsy. 22. 23. There is evidence discovered of bone tissue surrounding the surgical hole partially grown back, so therefore survival of the procedure did occur. At least on occasion. 16. The first known trepanning operation was carried out c. 5000 BCE in Ensisheim, France. 24. A possible amputation was carried out c. 4900 BCE in Bouthiers-Boulancourt, France. Many prehistoric peoples, which, where applicable, geographically and technologically, were able to set broken or fractured bones using clay materials. An injured area was covered in clay, which then set hard so that the bone could heal properly without interference. 1. Also, primarily in the Americas, the pincers of certain ant species were used to close up wounds from infection. The ant was held above the wound until it bit, where its head would be removed, allowing the pincers to remain and hold closed the wound. 25. Magic and medicine men. Yupik shaman exorcising evil spirits from a sick boy. 26. Main articles: Medicine Man and Shamanism. Medicine men, also witch doctors, shamans, maintained the health of their tribe by gathering and distributing herbs, performing minor surgical procedures. 27. Providing medical advice and supernatural treatments such as charms, spells, and amulets to ward off evil spirits. 28. In Apache society, as would likely have been the case in many others, the medicine men initiate a ceremony over the patient, which is attended by family and friends. It consists of magic formulas, prayers, and drumming. The medicine man then, from patients recalling of their past and possible offenses against their religion or tribal rules, reveals the nature of the disease and how to treat it. They were believed by the tribe to be able to contact spirits or gods and use their supernatural powers to cure the patient, and, in the process, remove evil spirits. If neither this method nor trepanning worked, the spirit was considered too powerful to be driven out of the person. Citation needed. Medicine men would likely have been central figures in the tribal system, because of their medical knowledge and because they could seemingly contact the gods. Their religious and medical training were, necessarily, passed down orally. 29. Dentistry. The earliest example of a drilled and filled-in tooth dates back to 13,000 years ago in Italy, where a tooth was filled with a mix of bitumen, hair and plant fiber. 30. Archaeologists in Mehrgarh in Balochistan province in the present-day Pakistan discovered that the people of Indus Valley Civilization from the early Harappan periods, circa 3300 BC, had knowledge of medicine and dentistry. The physical anthropologist who carried out the examinations, Professor Andrea Cusina from the University of Missouri, made the discovery when he was cleaning the teeth from one of the men. Later research in the same area found evidence of teeth having been drilled dating to 7000 BCE. 31. The problem of evidence. There is no written evidence that can be used for investigation into the prehistoric period of history by definition. Historians must use other sources such as human remains and anthropological studies of societies living under similar conditions. A variety of problems arise when the aforementioned sources are used. Human remains from this period are rare and many have undoubtedly been destroyed by burial rituals or made useless by damage. 32. 33. Circular reference. The most informative archaeological evidence are mummies, remains which have been preserved by either freezing or in peat bogs. Wink with a frown. 34. 35. No evidence exists to suggest that prehistoric people mummified the dead for religious reasons, as ancient Egyptians did. These bodies can provide scientists with subjects, at the time of death, weight, illnesses, height, diet, age, and bone conditions. 36. Circular reference, which grant vital indications of how developed prehistoric medicine was. Not technically classed as written evidence, prehistoric people left many kinds of paintings, using paints made of minerals such as lime, clay and charcoal, and brushes made from feathers, animal fur, or twigs on the walls caves. Although many of these paintings are thought to have a spiritual or religious purpose. 37. There have been some, such as a man with antlers, thought to be a medicine man, which have revealed some part of prehistoric medicine. Many cave paintings of human hands have shown missing fingers, none have been shown without thumbs, which suggests that these were cut off for sacrificial or practical purposes, as is the case among the Pygmies and Khoikhoi. 38. The writings of certain cultures, such as the Romans, can be used as evidence in discovering how their contemporary prehistoric cultures practiced medicine. People who live a similar nomadic existence today have been used as a source of evidence too, but obviously, there are distinct differences in the environments in which nomadic people lived. Prehistoric people who once lived in Britain, for example, cannot be effectively compared to Aboriginal peoples in Australia, because of the geographical differences. 39. See also: anthropology, bush medicine, human fat, mellified man, Native American ethnobotany, Paleolithic diet, primitive skills, sweat lodge, Venus of Willendorf. Art is a diverse range of human activity and resulting product that involves creative or imaginative talent expressive of technical proficiency, beauty, emotional power, or conceptual ideas. 1, 2, 3. There is no generally agreed definition of what constitutes art. 4, 5, 6, and its interpretation has varied greatly throughout history and across cultures. In the Western tradition, the three classical branches of visual art are painting, sculpture, and architecture. 7. Theater, dance, and other performing arts, as well as literature, music, film and other media such as interactive media, are included in a broader definition of the arts. 1. 8. Until the 17th century, art referred to any skill or mastery and was not differentiated from crafts or sciences. In modern usage after the 17th century, where aesthetic considerations are paramount, the fine arts are separated and distinguished from acquired skills in general, such as the decorative or applied arts. The nature of art and related concepts, such as creativity and interpretation, are explored in a branch of philosophy known as aesthetics. 9. The resulting artworks are studied in the professional fields of art criticism and the history of art. Overview. In the perspective of the history of art. 10. Artistic works have existed for almost as long as humankind, from early prehistoric art to contemporary art. However, some theorists think that the typical concept of artistic works does not fit well outside modern Western societies. 11. One early sense of the definition of art is closely related to the older Latin meaning, which roughly translates to skill or craft, as associated with words such as artisan. English words derived from this meaning include artifact, artificial, artifice, medical arts, and military arts. However, there are many other colloquial uses of the word, all with some relation to its etymology. 20th century bottle, TWA Peoples, Rwanda. Artistic works may serve practical functions, in addition to their decorative value. Over time, philosophers like Plato, Aristotle, Socrates and Immanuel Kant, among others, questioned the meaning of art. 12. Several dialogues in Plato tackle questions about art. Socrates says that poetry is inspired by the Muses, and is not rational. He speaks approvingly of this, and other forms of divine madness, drunkenness, eroticism, and dreaming, in the Phaedrus, 265a, c, and yet in the Republic wants to outlaw Homer's great poetic art, and laughter as well. In Ion, Socrates gives no hint of the disapproval of Homer that he expresses in the Republic. The dialogue Ion suggests that Homer's Iliad functioned in the ancient Greek world as the Bible does today in the modern Christian world, as divinely inspired literary art that can provide moral guidance, if only it can be properly interpreted. 13. With regards to the literary art and the musical arts, Aristotle considered epic poetry, tragedy, comedy, dithyrambic poetry and music to be mimetic or imitative art, each varying in imitation by medium, object, and manner. 14. For example, music imitates with the media of rhythm and harmony, whereas dance imitates with rhythm alone, and poetry with language. The forms also differ in their object of imitation. Comedy, for instance, is a dramatic imitation of men worse than average, whereas tragedy imitates men slightly better than average. Lastly, the forms differ in their manner of imitation through narrative or character, through change or no change, and through drama or no drama. 15. Aristotle believed that imitation is natural to mankind and constitutes one of mankind's advantages over animals. 16. The more recent and specific sense of the word art as an abbreviation for creative art or fine art emerged in the early 17th century. 17. Fine art refers to a skill used to express the artist's creativity, or to engage the audience's aesthetic sensibilities, or to draw the audience towards consideration of more refined or finer works of art. Within this latter sense, the word art may refer to several things: I. A study of a creative skill. 2. A process of using the creative skill. 3. A product of the creative skill, or 4. The audience's experience with the creative skill. The creative arts, art as discipline, are a collection of disciplines which produce artworks, art as objects, that are compelled by a personal drive, art as activity, and convey a message, mood, or symbolism for the perceiver to interpret, art as experience. Art is something that stimulates an individual's thoughts, emotions, beliefs, or ideas through the senses. Works of art can be explicitly made for this purpose or interpreted on the basis of images or objects. For some scholars, such as Kant, the sciences and the arts could be distinguished by taking science as representing the domain of knowledge and the arts as representing the domain of the freedom of artistic expression. 18. Back of a Renaissance oval basin or dish, in the Metropolitan Museum of Art. Often, if the skill is being used in a common or practical way, people will consider it a craft instead of art. Likewise, if the skill is being used in a commercial or industrial way, it may be considered commercial art instead of fine art. On the other hand, crafts and design are sometimes considered applied art. Some art followers have argued that the difference between fine art and applied art has more to do with value judgments made about the art than any clear definitional difference. 19. However, even fine art often has goals beyond pure creativity and self-expression. The purpose of works of art may be to communicate ideas, such as in politically, spiritually, or philosophically motivated art, to create a sense of beauty, see aesthetics, to explore the nature of perception, for pleasure, or to generate strong emotions. The purpose may also be seemingly non-existent. The nature of art has been described by philosopher Richard Woolheim as one of the most elusive of the traditional problems of human culture. 20. Art has been defined as a vehicle for the expression or communication of emotions and ideas, a means for exploring and appreciating formal elements for their own sake, and as mimesis or representation. Art as mimesis has deep roots in the philosophy of Aristotle. 21. Leo Tolstoy identified art as a use of indirect means to communicate from one person to another. 21. Benedetto Croce and R.G. Collingwood advanced the idealist view that art expresses emotions, and that the work of art therefore essentially exists in the mind of the creator. 22. 23. The theory of art as form has its roots in the philosophy of Kant, and was developed in the early 20th century by Roger Fry and Clive Bell. More recently, thinkers influenced by Martin Heidegger have interpreted art as the means by which a community develops for itself a medium for self-expression and interpretation. 24. George Dickey has offered an institutional theory of art that defines a work of art as any artifact upon which a qualified person or persons acting on behalf of the social institution commonly referred to as the art world has conferred the status of candidate for appreciation. 25. Larry Scheiner has described fine art as not an essence or a fate but something we have made. Art as we have generally understood it is a European invention barely 200 years old. 26. Art may be characterized in terms of mimesis, its representation of reality, narrative, storytelling, expression, communication of emotion, or other qualities. During the Romantic period, art came to be seen as the special faculty of the human mind to be classified with religion and science. 27. History. In The Origin of the Work of Art, Martin Heidegger, a German philosopher and seminal thinker, describes the essence of art in terms of the concepts of being and truth. He argues that art is not only a way of expressing the element of truth in a culture, but the means of creating it and providing a springboard from which that which is can be revealed. Works of art are not merely representations of the way things are, but actually produce a community's shared understanding. Each time a new artwork is added to any culture, the meaning of what it is to exist is inherently changed. Historically, art and artistic skills and ideas have often been spread through trade. An example of this is the Silk Road, where Hellenistic, Iranian, Indian and Chinese influences could mix. Greco-Buddhist art is one of the most vivid examples of this interaction. The meeting of different cultures and worldviews also influenced artistic creation. An example of this is the multicultural port metropolis of Trieste at the beginning of the 20th century, where James Joyce met writers from Central Europe, and the artistic development of New York City as a cultural melting pot. 52, 53. 54. Forms, genres, media, and styles. Napoleon I on his imperial throne by Ingres, French, 1806, oil on canvas. Main article, The Arts. The creative arts are often divided into more specific categories, typically along perceptually distinguishable categories such as media, genre, styles, and form. 55. Art form refers to the elements of art that are independent of its interpretation or significance. It covers the methods adopted by the artist and the physical composition of the artwork, primarily non-semantic aspects of the work, i.e., figure, 56, such as color, contour, dimension, medium, melody, space, texture, and value. Form may also include visual design principles, such as arrangement, balance, contrast, emphasis, harmony, proportion, proximity, and rhythm. 57. In general, there are three schools of philosophy regarding art, focusing respectively on form, content, and context. 57. Extreme formalism is the view that all aesthetic properties of art are formal, that is, part of the art form. Philosophers almost universally reject this view and hold that the properties and aesthetics of art extend beyond materials, techniques, and form. 58. Unfortunately, there is little consensus on terminology for these informal properties. Some authors refer to subject matter and content, i.e., denotations and connotations, while others prefer terms like meaning and significance. 57. Extreme intentionalism holds that authorial intent plays a decisive role in the meaning of a work of art, conveying the content or essential main idea, while all other interpretations can be discarded. 59. It defines the subject as the persons or idea represented. 60. And the content as the artist's experience of that subject. 61. For example, the composition of Napoleon I on his imperial throne is partly borrowed from the statue of Zeus at Olympia. As evidenced by the title, the subject is Napoleon, and the content is Ingres' representation of Napoleon as emperor god beyond time and space. 57. Similarly to extreme formalism, philosophers typically reject extreme intentionalism, because art may have multiple ambiguous meanings and authorial intent may be unknowable and thus irrelevant. Its restrictive interpretation is socially unhealthy, philosophically unreal, and politically unwise. 57. Finally, the developing theory of post-structuralism studies art's significance in a cultural context, such as the ideas, emotions, and reactions prompted by a work. 62, the cultural context often reduces to the artist's techniques and intentions, in which case analysis proceeds along lines similar to formalism and intentionalism. However, in other cases historical and material conditions may predominate, such as religious and philosophical convictions, socio-political and economic structures, or even climate and geography. Art criticism continues to grow and develop alongside art. 57. Art can connote a sense of trained ability or mastery of a medium. Art can also refer to the developed and efficient use of a language to convey meaning with immediacy or depth. Art can be defined as an act of expressing feelings, thoughts, and observations. 63. There is an understanding that is reached with the material as a result of handling it, which facilitates one's thought processes. A common view is that the epithet art, particular in its elevated sense, requires a certain level of creative expertise by the artist, whether this be a demonstration of technical ability, an originality in stylistic approach, or a combination of these two. Traditionally, skill of execution was viewed as a quality inseparable from art and thus necessary for its success. For Leonardo da Vinci, art, neither more nor less than his other endeavors, was a manifestation of skill. 64. Rembrandt's work, now praised for its ephemeral virtues, was most admired by his contemporaries for its virtuosity. 65. At the turn of the 20th century, the adroit performances of John Singer Sargent were alternately admired and viewed with skepticism for their manual fluency. 66. Yet at nearly the same time, the artist who would become the era's most recognized and peripatetic iconoclast, Pablo Picasso, was completing a traditional academic training at which he excelled. 67. 68. Detail of Leonardo da Vinci's Mona Lisa, circa 1503 to 1506, showing the painting technique of sfumato. A common contemporary criticism of some modern art occurs along the lines of objecting to the apparent lack of skill or ability required in the production of the artistic object. In conceptual art, Marcel Duchamp's Fountain is among the first examples of pieces wherein the artist used found objects, ready-made, and exercised no traditionally recognized set of skills. 69. Tracy Emin's My Bed, or Damien Hirst's The Physical Impossibility of Death in the Mind of Someone Living follow this example and also manipulate the mass media. Emin slept, and engaged in other activities, in her bed before placing the result in a gallery as work of art. Hirst came up with the conceptual design for the artwork but has left most of the eventual creation of many works to employed artisans. Hirst's celebrity is founded entirely on his ability to produce shocking concepts. 70. The actual production in many conceptual and contemporary works of art is a matter of assembly of found objects. However, there are many modernist and contemporary artists who continue to excel in the skills of drawing and painting and in creating hands-on works of art. 71. Purpose. A Navajo rug made c. 1880. Mozarabic Beatus miniature. Spain, late 10th century. Art has had a great number of different functions throughout its history, making its purpose difficult to abstract or quantify to any single concept. This does not imply that the purpose of art is vague, but that it has had many unique, different reasons for being created. Some of these functions of art are provided in the following outline. The different purposes of art may be grouped according to those that are non-motivated, and those that are motivated. Levi Strauss. 72. Non-motivated functions. The non-motivated purposes of art are those that are integral to being human, transcend the individual, or do not fulfill a specific external purpose. In this sense, art, as creativity, is something humans must do by their very nature, i.e., no other species creates art, and is therefore beyond utility. 72. Basic human instinct for harmony, balance, rhythm. Art at this level is not an action or an object, but an internal appreciation of balance and harmony, beauty, and therefore an aspect of being human beyond utility. Imitation, then, is one instinct of our nature. Next, there is the instinct for harmony and rhythm, meters being manifestly sections of rhythm. Persons, therefore, starting with this natural gift developed by degrees their special aptitudes, till their rude improvisations gave birth to poetry. Aristotle. 73. Experience of the mysterious. Art provides a way to experience one's self in relation to the universe. This experience may often come unmotivated, as one appreciates art, music, or poetry. The most beautiful thing we can experience is the mysterious. It is the source of all true art and science. Albert Einstein. 74. Expression of the imagination. Art provides a means to express the imagination in non-grammatic ways that are not tied to the formality of spoken or written language. Unlike words, which come in sequences and each of which have a definite meaning, art provides a range of forms, symbols and ideas with meanings that are malleable. Jupiter's eagle, as an example of art, is not, like logical, aesthetic, attributes of an object, the concept of the sublimity and majesty of creation, but rather something else, something that gives the imagination an incentive to spread its flight over a whole host of kindred representations that provoke more thought than admits of expression in a concept determined by words. They furnish an aesthetic idea, which serves the above rational idea as a substitute for logical presentation, but with the proper function, however, of animating the mind by opening out for it a prospect into a field of kindred representations stretching beyond its ken. Immanuel Kant, 75. Ritualistic and symbolic functions. In many cultures, art is used in rituals, performances and dances as a decoration or symbol. While these often have no specific utilitarian, motivated, purpose, anthropologists know that they often serve a purpose at the level of meaning within a particular culture. This meaning is not furnished by any one individual, but is often the result of many generations of change, and of a cosmological relationship within the culture. Most scholars who deal with rock paintings or objects recovered from prehistoric contexts that cannot be explained in utilitarian terms and are thus categorized as decorative, ritual or symbolic, are aware of the trap posed by the term art. Silva Tomaskova, 76. Motivated functions. Motivated purposes of art refer to intentional, conscious actions on the part of the artists or creator. These may be to bring about political change, to comment on an aspect of society, to convey a specific emotion or mood, to address personal psychology, to illustrate another discipline, to, with commercial arts, sell a product, or used as a form of communication. 72, 77. Communication. Art, at its simplest, is a form of communication. As most forms of communication have an intent or goal directed toward another individual, this is a motivated purpose. Illustrative arts, such as scientific illustration, are a form of art as communication. Maps are another example. However, the content need not be scientific. Emotions, moods and feelings are also communicated through art. Art is a set of artifacts or images with symbolic meanings as a means of communication. Steve Mithen, 78. Art as entertainment. Art may seek to bring about a particular emotion or mood, for the purpose of relaxing or entertaining the viewer. This is often the function of the art industries of motion pictures and video games. 79. The avant-garde. Art for political change. One of the defining functions of early 20th century art has been to use visual images to bring about political change. Art movements that had this goal, Dadaism, Surrealism, Russian Constructivism, and Abstract Expressionism, among others, are collectively referred to as the avant-garde arts. By contrast, the realistic attitude, inspired by positivism, from St. Thomas Aquinas to Anatole France, clearly seems to me to be hostile to any intellectual or moral advancement. I loathe it, for it is made up of mediocrity, hate, and dull conceit. It is this attitude which today gives birth to these ridiculous books, these insulting plays. It constantly feeds on and derives strength from the newspapers and stultifies both science and art by assiduously flattering the lowest of tastes, clarity bordering on stupidity, A Dog's Life. André Breton, Surrealism, 80. Art as a free zone, removed from the action of the social censure. Unlike the avant-garde movements, which wanted to erase cultural differences in order to produce new universal values, contemporary art has enhanced its tolerance towards cultural differences as well as its critical and liberating functions, social inquiry, activism, subversion, deconstruction, etc., becoming a more open place for research and experimentation. 81. Art for social inquiry, subversion, or anarchy. While similar to art for political change, subversive or deconstructivist art may seek to question aspects of society without any specific political goal. In this case, the function of art may be used to criticize some aspect of society. Graffiti art and other types of street art are graphics and images that are spray-painted or stenciled on publicly viewable walls, buildings, buses, trains, and bridges, usually without permission. Certain art forms, such as graffiti, may also be illegal when they break laws, in this case vandalism. Art for social causes. Art can be used to raise awareness for a large variety of causes. A number of art activities were aimed at raising awareness of autism, 82, 83, 84, cancer, 85, 86, 87, human trafficking, 88, 89, and a variety of other topics, such as ocean conservation, 90, human rights in Darfur, 91, murdered and missing Aboriginal women, 92, elder abuse, 93, and pollution, 94, trash ion, using trash to make fashion, practiced by artists such as Marina Debris is one example of using art to raise awareness about pollution. Art for psychological and healing purposes. Art is also used by art therapists, psychotherapists, and clinical psychologists as art therapy. The diagnostic drawing series, for example, is used to determine the personality and emotional functioning of a patient. The end product is not the principal goal in this case, but rather a process of healing, through creative acts, is sought. The resultant piece of artwork may also offer insight into the troubles experienced by the subject and may suggest suitable approaches to be used in more conventional forms of psychiatric therapy. 95. Art for propaganda, or commercialism. Art is often used as a form of propaganda, and thus can be used to subtly influence popular conceptions or mood. In a similar way, art that tries to sell a product also influences mood and emotion. In both cases, the purpose of art here is to subtly manipulate the viewer into a particular emotional or psychological response toward a particular idea or object. 96. Art as a fitness indicator. It has been argued that the ability of the human brain by far exceeds what was needed for survival in the ancestral environment. One evolutionary psychology explanation for this is that the human brain and associated traits, such as artistic ability and creativity, are the human equivalent of the peacock's tail. The purpose of the male peacock's extravagant tail has been argued to be to attract females, see also Fisherian runaway and handicap principle. According to this theory, superior execution of art was evolutionarily important because it attracted mates. 97. The functions of art described above are not mutually exclusive, as many of them may overlap. For example, art for the purpose of entertainment may also seek to sell a product, i.e. the movie or video game. Steps. Art can be divided into any number of steps one can make an argument for. This section divides the creative process into broad 3 steps, but there is no consensus on an exact number. 98. In the first step, the artist envisions the art in their mind. By imagining what their art would look like, the artist begins the process of bringing the art into existence. Preparation of art may involve approaching and researching the subject matter. Artistic inspiration is one of the main drivers of art and may be considered to stem from instinct, impressions, and feelings. 98. Creation. The Great Wave off Kanagawa, the first in Hokusai's series 36 views of Mount Fuji. In the second step, the artist executes the creation of their work. The creation of a piece can be affected by factors such as the artist's mood, surroundings, and mental state. For example, the Black Paintings by Francisco de Goya, created in the elder years of his life, are thought to be so bleak because he was in isolation and because of his experience with war. He painted them directly on the walls of his apartment in Spain, and most likely never discussed them with anyone. 99. The Beatles stated drugs such as LSD and cannabis influenced some of their greatest hits, such as Revolver, 100, 101, Trial and Error are considered an integral part of the creation process. 98. Appreciation. The last step is art appreciation, which has the subtopic of critique. In one study, over half of visual arts students agreed that reflection is an essential step of the art process. 98. According to education journals, the reflection of art is considered an essential part of the experience. 102, 103. However, an important aspect of art is that others may view and appreciate it as well. While many focus on whether those viewing/listening/etc. believe the art to be good/successful or not, art has profound value beyond its commercial success as a provider of information and health in society. 104. Art enjoyment can bring about a wide spectrum of emotion due to beauty. Some art is meant to be practical, with its analysis studious, meant to stimulate discourse. 105. Public access. The Metropolitan Museum of Art in Manhattan. Museums are important forums for the display of visual art. Since ancient times, much of the finest art has represented a deliberate display of wealth or power, often achieved by using massive scale and expensive materials. Much art has been commissioned by political rulers or religious establishments, with more modest versions only available to the most wealthy in society. 106. Nevertheless, there have been many periods where art of very high quality was available, in terms of ownership, across large parts of society, above all in cheap media such as pottery, which persists in the ground, and perishable media such as textiles and wood. In many different cultures, the ceramics of indigenous peoples of the Americas are found in such a wide range of graves that they were clearly not restricted to a social elite. 107, though other forms of art may have been. Reproductive methods such as molds made mass production easier, and were used to bring high-quality ancient Roman pottery and Greek Tanagra figurines to a very wide market. Cylinder seals were both artistic and practical, and very widely used by what can be loosely called the middle class in the ancient Near East. 108. Once coins were widely used, these also became an art form that reached the widest range of society. 109. Another important innovation came in the 15th century in Europe, when printmaking began with small woodcuts, mostly religious, that were often very small and hand-colored, and affordable even by peasants who glued them to the walls of their homes. Printed books were initially very expensive, but fell steadily in price until by the 19th century even the poorest could afford some with printed illustrations. 110. Popular prints of many different sorts have decorated homes and other places for centuries. 111. Kunstmuseum Basel, the Museum of Art in Basel, Switzerland, is the oldest public museum of art in the world. In 1661, the city of Basel, in Switzerland, opened the first public museum of art in the world, the Kunstmuseum Basel. Today, its collection is distinguished by an impressively wide historic span, from the early 15th century up to the immediate present. Its various areas of emphasis give it international standing as one of the most significant museums of its kind. These encompass paintings and drawings by artists active in the Upper Rhine region between 1400 and 1600, and on the art of the 19th to 21st centuries. 112. Public buildings and monuments, secular and religious, by their nature normally address the whole of society, and visitors as viewers, and display to the general public has long been an important factor in their design. Egyptian temples are typical in that the most largest and most lavish decoration was placed on the parts that could be seen by the general public, rather than the areas seen only by the priests. 113. Many areas of royal palaces, castles and the houses of the social elite were often generally accessible, and large parts of the art collections of such people could often be seen either by anybody, or by those able to pay a small price, or those wearing the correct clothes, regardless of who they were, as at the Palace of Versailles, where the appropriate extra accessories, silver shoe buckles and a sword, could be hired from shops outside. 114. Special arrangements were made to allow the public to see many royal or private collections placed in galleries, as with the Orleans collection mostly housed in a wing of the Palais Royal in Paris, which could be visited for most of the 18th century. 115. In Italy, the art tourism of the Grand Tour became a major industry from the Renaissance onwards, and governments and cities made efforts to make their key works accessible. The British Royal Collection remains distinct, but large donations such as the Old Royal Library were made from it to the British Museum, established in 1753. The Uffizi in Florence opened entirely as a gallery in 1765, though this function had been gradually taking the building over from the original civil servants' offices for a long time before. 116. The building now occupied by the Prado in Madrid was built before the French Revolution for the public display of parts of the royal art collection, and similar royal galleries open to the public existed in Vienna, Munich and other capitals. The opening of the Musée du Louvre during the French Revolution, in 1793, as a public museum for much of the former French royal collection certainly marked an important stage in the development of public access to art, transferring ownership to a republican state, but was a continuation of trends already well established. 117. Most modern public museums and art education programs for children in schools can be traced back to this impulse to have art available to everyone. However, museums do not only provide availability to art, but do also influence the way art is being perceived by the audience, as studies found. 118. Thus, the museum itself is not only a blunt stage for the presentation of art, but plays an active and vital role in the overall perception of art in modern society. Museums in the United States tend to be gifts from the very rich to the masses. The Metropolitan Museum of Art in New York City, for example, was created by John Taylor Johnston, a railroad executive whose personal art collection seeded the museum. But despite all this, at least one of the important functions of art in the 21st century remains as a marker of wealth and social status. 119. There have been attempts by artists to create art that cannot be bought by the wealthy as a status object. One of the prime original motivators of much of the art of the late 1960s and 1970s was to create art that could not be bought and sold. It is necessary to present something more than mere objects. 120, said the major post-war German artist Joseph Beuys. This time period saw the rise of such things as performance art, video art, and conceptual art. The idea was that if the artwork was a performance that would leave nothing behind, or was an idea, it could not be bought and sold. Democratic precepts revolving around the idea that a work of art is a commodity impelled the aesthetic innovation which germinated in the mid-1960s and was reaped throughout the 1970s. Artists broadly identified under the heading of conceptual art, substituting performance and publishing activities for engagement with both the material and materialistic concerns of painted or sculptural form, have endeavored to undermine the art object qua object. 121. Versailles, Louis Lvov opened up the interior court to create the expansive entrance Cour d'honneur, later copied all over Europe. In the decades since, these ideas have been somewhat lost as the art market has learned to sell limited edition DVDs of video works. 122, invitations to exclusive performance art pieces, and the objects left over from conceptual pieces. Many of these performances create works that are only understood by the elite who have been educated as to why an idea or video or piece of apparent garbage may be considered art. The marker of status becomes understanding the work instead of necessarily owning it, and the artwork remains an upper-class activity. With the widespread use of DVD recording technology in the early 2000s, artists, and the gallery system that derives its profits from the sale of artworks, gained an important means of controlling the sale of video and computer artworks in limited editions to collectors. 123. Controversies. Art has long been controversial, that is to say disliked by some viewers, for a wide variety of reasons, though most pre-modern controversies are dimly recorded, or completely lost to a modern view. Iconoclasm is the destruction of art that is disliked for a variety of reasons, including religious ones. Aniconism is a general dislike of either all figurative images, or often just religious ones, and has been a thread in many major religions. It has been a crucial factor in the history of Islamic art, where depictions of Muhammad remain especially controversial. Much art has been disliked purely because it depicted or otherwise stood for unpopular rulers, parties, or other groups. Artistic conventions have often been conservative and taken very seriously by art critics, though often much less so by a wider public. The iconographic content of art could cause controversy, as with late medieval depictions of the new motif of the swoon of the Virgin in scenes of the crucifixion of Jesus. The Last Judgment by Michelangelo was controversial for various reasons, including breaches of decorum through nudity and the Apollo-like pose of Christ. 124, 125. The content of much formal art through history was dictated by the patron or commissioner rather than just the artist, but with the advent of Romanticism and economic changes in the production of art, the artist's vision became the usual determinant of the content of his art, increasing the incidence of controversies, though often reducing their significance. Strong incentives for perceived originality and publicity also encouraged artists to court controversy. Theodore Géricault's Raft of the Medusa, circa 1820, was in part a political commentary on a recent event. Edouard Manet's Le Déjeuner sur l'herbe, 1863, was considered scandalous not because of the nude woman, but because she is seated next to men fully dressed in the clothing of the time, rather than in robes of the antique world. 126, 127, John Singer Sargent's Madame Pierre Gautreau, Madame X, 1884, caused a controversy over the reddish-pink used to color the woman's ear-lobe, considered far too suggestive and supposedly ruining the high society model's reputation. 128, 129, the gradual abandonment of naturalism and the depiction of realistic representations of the visual appearance of subjects in the 19th and 20th centuries led to a rolling controversy lasting for over a century. Performance by Joseph Beuys, 1978, Everyone an Artist, on the way to the libertarian form of the social organism. In the 20th century, Pablo Picasso's Guernica, 1937, used arresting cubist techniques and stark monochromatic oils to depict the harrowing consequences of a contemporary bombing of a small, ancient Basque town. Leon Golub's Interrogation 3, 1981, depicts a female nude, hooded detainee strapped to a chair, her legs open to reveal her sexual organs, surrounded by two tormentors dressed in everyday clothing. André Serrano's Piss Christ, 1989, is a photograph of a crucifix, sacred to the Christian religion and representing Christ's sacrifice and final suffering, submerged in a glass of the artist's own urine. The resulting uproar led to comments in the United States Senate about public funding of the arts. 131. Before modernism, aesthetics in Western art was greatly concerned with achieving the appropriate balance between different aspects of realism or truth to nature and the ideal. Ideas as to what the appropriate balance is have shifted to and fro over the centuries. This concern is largely absent in other traditions of art. The aesthetic theorist John Ruskin, who championed what he saw as the naturalism of J. M. W. Turner, saw art's role as the communication by artifice of an essential truth that could only be found in nature. 132. The definition and evaluation of art has become especially problematic since the 20th century. Richard Woolheim distinguishes three approaches to assessing the aesthetic value of art: the realist, whereby aesthetic quality is an absolute value independent of any human view; the objectivist, whereby it is also an absolute value, but is dependent on general human experience; and the relativist position, whereby it is not an absolute value, but depends on, and varies with, the human experience of different humans. 133. Arrival of modernism. Composition with red, blue and yellow, 1930, by Piet Mondrian, Dutch, 1872–1944. The arrival of modernism in the late 19th century led to a radical break in the conception of the function of art. 134, and then again in the late 20th century with the advent of postmodernism. Clement Greenberg's 1960 article Modernist Painting defines modern art as the use of characteristic methods of a discipline to criticize the discipline itself. 135. Greenberg originally applied this idea to the abstract expressionist movement and used it as a way to understand and justify flat, non-illusionistic, abstract painting. Realistic, naturalistic art had dissembled the medium, using art to conceal art. Modernism used art to call attention to art. The limitations that constitute the medium of painting, the flat surface, the shape of the support, the properties of the pigment, were treated by the old masters as negative factors that could be acknowledged only implicitly or indirectly. Under modernism, these same limitations came to be regarded as positive factors, and were acknowledged openly. 135. After Greenberg, several important art theorists emerged, such as Michael Fried, T. J. Clarke, Rosalind Krauss, Linda Nochlin and Griselda Pollock, among others. Though only originally intended as a way of understanding a specific set of artists, Greenberg's definition of modern art is important to many of the ideas of art within the various art movements of the 20th century and early 21st century. 136. 137. Pop artists like Andy Warhol became both noteworthy and influential through work including and possibly critiquing popular culture, as well as the art world. Artists of the 1980s, 1990s, and 2000s expanded this technique of self-criticism beyond high art to all cultural image-making, including fashion images, comics, billboards and pornography. 138. 139. Duchamp once proposed that art is any activity of any kind, everything. However, the way that only certain activities are classified today as art is a social construction. 140. There is evidence that there may be an element of truth to this. In The Invention of Art, A Cultural History, Larry Scheiner examines the construction of the modern system of the arts, i.e. fine art. He finds evidence that the older system of the arts before our modern system, fine art, held art to be any skilled human activity. For example, ancient Greek society did not possess the term art, but techne. Techne can be understood neither as art or craft, the reason being that the distinctions of art and craft are historical products that came later on in human history. Techne included painting, sculpting and music, but also cooking, medicine, horsemanship, geometry, carpentry, prophecy, and farming, etc. 141. New criticism and the intentional fallacy. Following Duchamp during the first half of the 20th century, a significant shift to general aesthetic theory took place which attempted to apply aesthetic theory between various forms of art, including the literary arts and the visual arts, to each other. This resulted in the rise of the new criticism school and debate concerning the intentional fallacy. At issue was the question of whether the aesthetic intentions of the artist in creating the work of art whatever its specific form, should be associated with the criticism and evaluation of the final product of the work of art, or, if the work of art should be evaluated on its own merits independent of the intentions of the artist. 142, 143. In 1946, William K. Wimsatt and Monroe Beardsley published a classic and controversial new critical essay entitled The Intentional Fallacy, in which they argued strongly against the relevance of an author's intention, or intended meaning in the analysis of a literary work. For Wimsatt and Beardsley, the words on the page were all that mattered, importation of meanings from outside the text was considered irrelevant, and potentially distracting. 144, 145. In another essay, The Effective Fallacy, which served as a kind of sister essay to The Intentional Fallacy, Wimsatt and Beardsley also discounted the reader's personal/emotional reaction to a literary work as a valid means of analyzing a text. This fallacy would later be repudiated by theorists from the reader response school of literary theory. Ironically, one of the leading theorists from this school, Stanley Fish, was himself trained by new critics. Fish criticizes Wimsatt and Beardsley in his 1970 essay Literature in the Reader. 146, 147. As summarized by Barry Scott and Paisley Livingston in their essay The Creation of Art, structuralist and post-structuralist theorists and critics were sharply critical of many aspects of new criticism, beginning with the emphasis on aesthetic appreciation and the so-called autonomy of art. But they reiterated the attack on biographical criticism's assumption that the artist's activities and experience were a privileged critical topic. 148. These authors contend that anti-intentionalists, such as formalists, hold that the intentions involved in the making of art are irrelevant or peripheral to correctly interpreting art. So details of the act of creating a work, though possibly of interest in themselves, have no bearing on the correct interpretation of the work. 149. Gott and Livingston define the intentionalists as distinct from formalists, stating that intentionalists, unlike formalists, hold that reference to intentions is essential in fixing the correct interpretation of works. They quote Richard Woolheim as stating that the task of criticism is the reconstruction of the creative process, where the creative process must in turn be thought of as something not stopping short of, but terminating on, the work of art itself. 149. Linguistic turn and its debate. The end of the 20th century fostered an extensive debate known as the linguistic turn controversy, or the innocent eye debate in the philosophy of art. This debate discussed the encounter of the work of art as being determined by the relative extent to which the conceptual encounter with the work of art dominates over the perceptual encounter with the work of art. 150. Decisive for the linguistic turn debate in art history and the humanities were the works of yet another tradition, namely the structuralism of Ferdinand de Saussure and the ensuing movement of post-structuralism. In 1981, the artist Mark Tansey created a work of art titled The Innocent Eye as a criticism of the prevailing climate of disagreement in the philosophy of art during the closing decades of the 20th century. Influential theorists include Judith Butler, Luce Irigaray, Julia Kristeva, Michel Foucault, and Jacques Derrida. The power of language, more specifically of certain rhetorical tropes, in art history and historical discourse was explored by Hayden White. The fact that language is not a transparent medium of thought had been stressed by a very different form of philosophy of language which originated in the works of Johann Georg Hamann and Wilhelm von Humboldt. 151, Ernst Gombrich and Nelson Goodman in his book Languages of Art. An approach to a theory of symbols came to hold that the conceptual encounter with the work of art predominated exclusively over the perceptual and visual encounter with the work of art during the 1960s and 1970s. 152. He was challenged on the basis of research done by the Nobel Prize-winning psychologist Roger Sperry, who maintained that the human visual encounter was not limited to concepts represented in language alone, the linguistic turn, and that other forms of psychological representations of the work of art were equally defensible and demonstrable. Sperry's view eventually prevailed by the end of the 20th century, with aesthetic philosophers such as Nick Zangwill strongly defending a return to moderate aesthetic formalism among other alternatives. 153. Classification disputes. Main article, Classificatory disputes about art. The original fountain by Marcel Duchamp, 1917, photographed by Alfred Stieglitz at the 291 after the 1917 Society of Independent Artists exhibit. Stieglitz used a backdrop of The Warriors by Marsden Hartley to photograph the urinal. The exhibition entry tag can be clearly seen. 154. Disputes as to whether or not to classify something as a work of art are referred to as classificatory disputes about art. Classificatory disputes in the 20th century have included Cubist and Impressionist paintings, Duchamp's Fountain, the movies, J.S.G. Boggs' superlative imitations of banknotes, conceptual art, and video games. 155. Philosopher David Novitz has argued that disagreement about the definition of art are rarely the heart of the problem. Rather, the passionate concerns and interests that humans vest in their social life are so much a part of all classificatory disputes about art. 156. According to Novitz, classificatory disputes are more often disputes about societal values and where society is trying to go than they are about theory proper. For example, when the Daily Mail criticized Hirst's and Emmons' work by arguing for 1,000 years art has been one of our great civilizing forces. Today, pickled sheep and soiled beds threaten to make barbarians of us all. They are not advancing a definition or theory about art, but questioning the value of Hirst's and Emmons' work. 157. In 1998, Arthur Danto suggested a thought experiment showing that the status of an artifact as work of art results from the ideas a culture applies to it, rather than its inherent physical or perceptible qualities. Cultural interpretation, an art theory of some kind, is therefore constitutive of an object's arthood. 158. 159. Anti-art is a label for art that intentionally challenges the established parameters and values of art. Wink with a frown. 160. It is a term associated with Dadaism and attributed to Marcel Duchamp just before World War I. 160. When he was making art from found objects. 160. One of these, Fountain, 1917, an ordinary urinal, has achieved considerable prominence and influence on art. 160. Anti-art is a feature of work by Situationist International. 161. The lo-fi male art movement, and the young British artists. 160. Though it is a form still rejected by the Stuckists. 160. Who describe themselves as anti-art. 162. 163. Architecture is often included as one of the visual arts. However, like the decorative arts, or advertising, it involves the creation of objects where the practical considerations of use are essential in a way that they usually are not in a painting. For example, 164. Value judgment. Aboriginal hollow log tombs. National Gallery, Canberra, Australia. Somewhat in relation to the above, the word art is also used to apply judgments of value, as in such expressions as that meal was a work of art, the cook is an artist, or the art of deception. The highly attained level of skill of the deceiver is praised. It is this use of the word as a measure of high quality and high value that gives the term its flavor of subjectivity. Making judgments of value requires a basis for criticism. At the simplest level, a way to determine whether the impact of the object on the senses meets the criteria to be considered art is whether it is perceived to be attractive or repulsive. Though perception is always colored by experience, and is necessarily subjective, it is commonly understood that what is not somehow aesthetically satisfying cannot be art. However, good art is not always or even regularly aesthetically appealing to a majority of viewers. In other words, an artist's prime motivation need not be the pursuit of the aesthetic. Also, art often depicts terrible images made for social, moral, or thought-provoking reasons. For example, Francisco Goya's painting depicting the Spanish shootings of May 3, 1808 is a graphic depiction of a firing squad executing several pleading civilians. Yet at the same time, the horrific imagery demonstrates Goya's keen artistic ability in composition and execution and produces fitting social and political outrage. Thus, the debate continues as to what mode of aesthetic satisfaction, if any, is required to define art. 165, 166. The assumption of new values or the rebellion against accepted notions of what is aesthetically superior need not occur concurrently with a complete abandonment of the pursuit of what is aesthetically appealing. Indeed, the reverse is often true, that the revision of what is popularly conceived of as being aesthetically appealing allows for a reinvigoration of aesthetic sensibility, and a new appreciation for the standards of art itself. Countless schools have proposed their own ways to define quality, yet they all seem to agree in at least one point. Once their aesthetic choices are accepted, the value of the work of art is determined by its capacity to transcend the limits of its chosen medium to strike some universal chord by the rarity of the skill of the artist or in its accurate reflection in what is termed the zeitgeist. Art is often intended to appeal to and connect with human emotion. It can arouse aesthetic or moral feelings, and can be understood as a way of communicating these feelings. Artists express something so that their audience is aroused to some extent, but they do not have to do so consciously. Art may be considered an exploration of the human condition, that is, what it is to be human. 167. By extension, it has been argued by Emily L. Spratt that the development of artificial intelligence, especially in regard to its uses with images, necessitates a re-evaluation of aesthetic theory in art history today and a reconsideration of the limits of human creativity. 168, 169. Art and law. An essential legal issue are art forgeries, plagiarism, replicas, and works that are strongly based on other works of art. Intellectual property law plays a significant role in the art world. Copyright protection is granted to artists for their original works, providing them with exclusive rights to reproduce, distribute, and display their creations. This safeguard empowers artists to govern the usage of their work and safeguard against unauthorized copying or infringement. 170. The trade in works of art or the export from a country may be subject to legal regulations. Internationally, there are also extensive efforts to protect the works of art created. The UN, UNESCO, and Blue Shield International try to ensure effective protection at the national level and to intervene directly in the event of armed conflicts or disasters. This can particularly affect museums, archives, art collections, and excavation sites. This should also secure the economic basis of a country, especially because works of art are often of tourist importance. The founding president of Blue Shield International, Karl von Habsburg, explained an additional connection between the destruction of cultural property and the cause of flight during a mission in Lebanon in April 2019. Cultural goods are part of the identity of the people who live in a certain place. If you destroy their culture, you also destroy their identity. Many people are uprooted, often no longer have any prospects, and as a result flee from their homeland. 171, 172, 173, 174, 175, 176. In order to preserve the diversity of cultural identity, UNESCO protects the living human treasure through the Convention for the Safeguarding of the Intangible Cultural Heritage. See also: Icon Arts Portal, Icon Visual Arts Portal, Applied Arts, Art Movement, Artist in Residence, Artistic Freedom, Cultural Tourism, Craftivism, Formal Analysis, History of Art, List of Artistic Media, List of Art Techniques, Mathematics and Art, Street Art or Independent Public Art, Outline of the Visual Arts, a guide to the subject of art presented as a tree-structured list of its subtopics. Visual impairment in art.